Yes, yes, it's talking. Go ahead.
Good morning, sir.
Good morning. Oh, let me answer few of the emails because they are so tried this passcode before. Okay.
Good morning, sir.
Good morning. Good morning.
Good morning, sir.
Very good morning. The passcode 253069 is active. So from today onwards, there won't be any problem of what occurred last time. The room full. We have got enough licenses, so no worries. As such, we have crossed the number 100. So now there is no trouble till 1100. All right, so it's exact 10 o'clock, and I think it's time to start. We wait for 5 minutes. Anyway, so welcome to the beautiful world of medicine, right? Actually, today we'll be considering it as day one, right? And why I said warming up, some basic things. This is the email address. This is still urmbbs@gmail.com, and it is really, I'm very thankful to so many of you. I got 35 emails, 35 emails in one day, right? And yes, all the concerns. I must have replied to many of you like, yes, we'll be discussing it online. So that is in the benefit of everyone. So many questions, they were pretty good questions that what should be the pattern of studies, how can we increase our pace, this, that, everything will be covered. Today, you'll be getting a complete idea about what would be our action plan. So this is the email address, and this email address, this will be the link between you and me. So you must have noticed that I have replied to almost all of the emails except the last 15 emails which I have received within few minutes, but most of them they are about this passcode only. So I'm not replying to all of you. Most probably, I think you guys are there, right? All right. So this is Tuesday, Thursday, Saturday. You know that we'll be meeting at 10 a.m. And no need to come early, right? Because we'll be activating. It is like I do this at 253069. This passcode will be activated at 9:55 only. So come at that point and straight away within 5 minutes, and we'll start with our topic. Right? This is my brief introduction. Did my MBBS, DMRE, MD radiology with super specialization in spine. And rest of the degrees, right? This is CCNP. There are overall 23 degrees. So CCNP is Cisco Certified Network Professional. MCSD is Microsoft Certified Solution Developer. Microsoft Certified Database. It is A. Administrator. This is Sun's Microsystems System Administrator. and Sun Microsystem Certified Network Administrator. There are another 18 degrees also, but they are all related to IT. As I told you last time that I worked with Steve Jobs also. And these are the medals, 118 medals in marathon and ultra marathons, and divided into two parts because I suffered very badly in COVID. So that was very dangerous. It was almost on the verge of deathbed. But God's grace and love of everyone survived. So first group, this is pre-COVID. This is pre-COVID. And that protein which is utilized by brain and heart. And that's how it all went well, survived. Okay, so this is, apart from this, yes, there are some other things also. I'm into painting, photography, etc., which we will discuss as we proceed and when needed. So let's start with our today's step. Few things which I'm committing to you, right? It is like my commitment to you, but at the same time, today I'll be demanding something from you. So I'll write it down and it will be very specific. And this is something which is needed. What my guarantee is that in none of the exam you'll face any problem. And when I say this, it is a big statement, right? It is not only like your final MBBS exam or next exam or no, it is like you want to appear for USMLE, my guarantee, there won't be any problem. But some very basic commitment, very basic commitment. You follow it and see the difference. Okay. Just a minute. Is the volume okay? Is volume okay?
Yes,
Yes.
sir.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Om, I got your email. That's why I asked this question, but still, okay. I'll try to speak still louder. But most probably it should be okay. Reason? We are connected with what is called as the OBS. This is online broadcasting studio. And I have put the volume max over here. So if I'm into green zone and this yellow zone, because now if I speak very loudly, right, it will go into red zone. So there the voice quality would be very poor. But over here, as far as we are into green zone, it should be okay. So please just check your system. Still, in case if you got any problem, try to relog. Things should resolve. Okay, so what I was telling was the commitment, which I really want from you. The first thing. We'll wait for just 2 minutes wait state. 2 minutes wait state. That means at sharp 10:02, we'll be starting with our topic. We'll not be delaying it like let's wait for 5 minutes and 10 minutes and no, we'll not do that. Right now, say it is 6 minutes past 10. Still many of the friends, they are joining, but today it is okay. It is possible, right? That there might be some confusion regarding the passcode, etc. And I'll repeat this thing also once everyone joins, because the numbers are increasing. Now we are at 315. But it is for everyone that will be starting at sharp 10:02. So try to remain very punctual. This is the first expectation. Okay? The second, whatever the topic which we discuss, I insist that you revise it. And what should be the pattern of revision? I'll show you a very specific pattern of revision. This pattern of revision, if you follow, you'll be able to remember it for a very long time. And this is nothing but what's called as the super reading. The purpose of this super reading is, which will be will be a special session which we'll be conducting next week, right? We'll be conducting it on Tuesday. But this super reading is what? Super reading is for 21 days. For 21 days, you have to rigidly, strictly, religiously follow the pattern whatever we'll be discussing. This will be the pattern which will take you to much higher levels. That means you read anything once or twice and you'll be able to recollect it much at a much faster rate. So this is the secret, because it is said that when we were in 10th standard, if we consider that it was unit 1, right, in 12th standard the workload increased by 5 times, but when you are telling about mbbs, this workload will increase by 100 times. So the patterns which we followed till 12th, right, they won't be applicable in mbbs. It won't be possible. We won't be able to cram the things. Even if someone passes by cramming the subjects or cramming few of the questions, the problem occurs when we'll be going for USMLE, right? One of the finest exams. Advantage, yes, we'll be going in depth about all the steps. Step 1, step 2, how to crack this exam, where I'll be helpful to you, how to proceed. Everything we'll be discussing, and this discussion will be tomorrow, right? So tomorrow, I mean day after tomorrow. So that means it will be on Saturday. So on Saturdays, if possible, right, you can always tell your parents to join. It will be very important. And like today, because I am finding that entire room is so disciplined, though everyone has got the right to unmute themselves, there is not a single extra noise. So I really appreciate that, right? Very nice. Okay. So on Saturday, we'll be discussing USMLE, United States Medical Licensing Examination. Why this exam? After completion of MBBS, irrespective of from any of the country, you have to come back to India if you want to practice in India. You have to practice in India, or you want to go for the post graduation. You have to appear for that exam, what is called as the next National Exit Test. After the completion of this exam, you will be going for post graduation. Now, because this exam would be given by every Indian student also, so they'll be under the direct fire line with you, in the direct competition with you. Now, I'm not doubting your intelligence, right? I'm not at all doubting your intelligence, but it is like there would be a stiff competition. And even in that, the number of post graduation seats, they are much less as compared to the number of candidates which are enrolling, right? So if there are 40,000 candidates which are enrolling for this exam, number is much bigger, but I'm just giving the example. The number of seats, they are hardly 20%. Matlab 80% log, they won't be getting post graduation. So is it end of the world? Khatam? Not really, right? We need to find out the path, and that is what is called as the USMLE. So in USMLE, it is right now, if your age is 20 years, consider it this way, that up to the age of 30, minimum 30, you have to study. You have to give the entire decade of life. 10 saal dene hain, 10 years. That's why it is not a small race. It is a long race. 10 saal dene hain zindagi ke. And it's very much needed. But after 10 years, 10 साल में आपके जितने दूसरे कलीग्स होंगे, दूसरे फ्रेंड्स होंगे, दे विल बी ओवरटेकिंग यू. मतलब 26 साल 28 साल में तो बाप बन गए होंगे, माँ बन गए होंगे. एंड देन यू आर स्टडिंग, कहीं जॉब शुरू कर दी होगी, कहीं बिजनेस कर रहे होंगे, एंड दे विल बी टेलिंग कि अरे यार तू इतना नहीं कमाता, हम तो इतना कमाते हैं, वी डन दिस मच. बट ट्रस्ट मी, after this, when you will start earning, you'll be overtaking them within 1 year. And then it goes that high. Why this? Because even bada grossly bhi if we count now, so MBBS will take about 5 years, 5.5 years. 1 साल की internship, 3 साल का post graduation. So 10 साल जैसे तो यही निकल गए. And this is when everything goes flawless. And I really wish that किसी को कहीं पे प्रॉब्लम ना हो. Everyone clears all the exams on a single shot. So this is what should be in our mind. क्यों जरूरी? In college, in school, right? जब 12th पास करते थे, तो there were so many people ना motivate करने के लिए, मम्मी, डैडी, friends. अरे don't worry. Once you are in other country, that motivation factor तो थोड़ा कम हो जाएगा. There'll be distracting factors. There'll be so many distracting factors. So that's why all of you should be very much self-motivated. कई बार लगता है ना कि ये क्या है, why this is necessary. बस ये आज के दिन के लिए ही है. उसके बाद I'll never tell you कि you should be self-motivated. Because I'll take it for granted कि आपने ये चीजें याद रख ली. But if there is any trouble, that's why that email address is given. Yes, you can. There are 3, 4, 5. Okay. I won't be able to read those long emails right now, right? But yes, at any time, if you got even a personal problem, you can send a mail, right? In nutshell, in a simple line, I have answered to almost 3, 4 emails. Okay? Yes, you can talk to me. And that thing will remain between you and me. But I want results. I'll be conducting exams at regular interval. Initially, तो I'll be declaring that ठीक है, चलिए next week Saturday we'll be conducting exam. ठीक है? This is one thing. But as we'll progress, I'll be conducting surprise tests. Surprise test means आपको बताऊंगा भी नहीं. I won't be telling you कि कब test. And suddenly when we are ready, we'll say कि okay चलो, today we'll be having test. Is this okay? Is this okay? करना है?
Yes, sir.
Yes.
Yes, sir.
Of course, sir.
Yes, sir.
Perfect.
Yes, sir.
अबे जरूरत क्या है ऐसा करने की? Why this is needed? प्लान करके करते हैं टेस्ट. ये क्या अनप्लान टेस्ट? बिकॉज पेशेंट बोल के नहीं आएगा कि सर आई गॉट माइट्रल स्टेनोसिस और मैं आज आ रहा हूं. In medical science, when the patient comes, you should be able to diagnose. So that's why engineering में फर्स्ट ईयर, सेकंड ईयर, थर्ड ईयर एग्जाम कैसी? फर्स्ट ईयर के सब्जेक्ट एग्जाम दी, खत्म. उसके बाद जिंदगी में कभी नहीं आएंगे. फिर सेकंड ईयर एग्जाम दी, खत्म. थर्ड ईयर एग्जाम दी, खत्म. Over here also it happens like this, but the difference is first year में आपने anatomy पढ़ी, right? Physiology is normal process. In second year you are learning pathology. So pathology is what? It is deviation from the normal, that is pathology. Okay, आगे बढ़े तो then medicine means कि how to diagnose this pathology. ये pharmacology, यहाँ पे treatment आ रही है, right? So that means you have to remember pharmacology. It means you can't afford to forget anything. You can't afford to forget because everything is mounted one over other. So if there is no proper revision pattern, you'll start forgetting the things. And तकलीफ तब होती है जब final MBBS में you are trying to learn some subject, and if the concepts are not clear, trouble. बहुत बड़ी तकलीफ, right? So that's the reason these classes we are conducting, right? My guarantee, your foundation would be so crisp clean that in future you won't be having any problem. Whatever your questions, whatever. Yes, I teach all the 19 subjects of MBBS, all the subjects, right? Right from the anatomy, physiology, biochemistry, pharmac, patho, microbio, surgery, medicine, gynecology, ophthalmology, ENT, forensics, radiology, anesthesia, dermatology, everything till the end, including the psychiatry. All the 19 subjects. And all of them, they will be what is called as the integrated thing. So what is this integration? Integration means, let's say we are learning thorax. Thorax means chest, right? The whole body. This is how the thing, head and neck. This is head and neck, right? Then this would be called as the thorax. Then that's abdomen, pelvis, upper limb, lower limb. Right? These are the regions. This is how the entire anatomy would be studied. But when we are studying thorax, I'll also show you X-rays. Not only showing you the X-ray, but we'll be having one session on how to see the X-ray. Because this is like when students they come into clinics, by default it is expected that yes, they should know how to read the X-rays. No, we will teach you right from the beginning. The topics in the college and your lectures will be same or they will vary. All right, Hanska, the thing is, there are all the chances. Say till you go to college, right? Till you go to college, follow this pattern. Once you will reach to the college, even our timings would change because you won't be free on Tuesdays, Thursdays. So we'll be shifting it to only the weekends, right? But the duration would increase. Will the topics be same? No, topics won't be same. We'll be moving much ahead. We'll be moving much ahead, right? Because in college, no one will teach you the X-rays, right? It will come, but it might come in second year or third year. Who says that a first year student can't learn X-ray, can't learn CT scan, can't learn MRI? Definitely, beyond doubt, I guarantee you will be able to diagnose. It is like your brains are ready, right? And the enthusiasm level is usually very high. So in this stage, what even the difficult topics, you'll be absorbing it like anything. I'll be giving you all the PDFs, I'll be giving you X-ray, CT scan, everything. Take it as much as you want. Digest it, learn it, any query, send an email. But the point is, कि अगर जो आपने पढ़ाई नहीं की, right? Test भी अपनी, I trust you fully and completely. What would be the test pattern? Test pattern would be like, say, this is screen. Over here, it will be written like question number 1, and the question would be mentioned, and you have to write the answer. Right? Usually, in my test, I don't give MCQs, multiple choice questions, because multiple choice question क्या गप्पा ब्लफ करने का चांस कुछ नहीं आता ABCD में से randomly चलो select one. नहीं, you have to really write the answer. When you really write the answer, and some of the cases I might say why, you have to give the reason also, right? So that gives you much better, deeper understanding of the subject. This is not the exam pattern of next or USMLE. But अभी से एग्जाम की क्यों टेंशन करनी? We want to learn the subject. जब एग्जाम आएगी, I'll prepare you for the exam, but not right now. Right now, our entire focus will be on the concept, raw concepts. Because if the building is to be constructed और ये foundation strong है ना, तो बनाइए कितनी भी बड़ी building, कोई problem नहीं होगी. So this is the reason that our exams will be like that. Who will check the question paper? You don't have to send it to me. कुछ नहीं. Immediately after the exam, we'll solve it back to back. And then that will solve this paper in with complete understanding and depth, where I'll be mentioning that have you mentioned these words? Have you written this word? If yes, yes, give yourself 1 mark. If not, सीधा deduct ही कर दो. And then I'll just tell you that tell me how much have you got. Bas. So this will be like a totally इसके अंदर से सपोज एक क्वेश्चन ऐसा भी किसी ने पूछा था, व्हाट इफ हम बुक में से देख ले, अरे देखो ना, हु इज एट द लॉस, है ना? बस तो ये जो टेस्ट है, व्हेन यू गिव इट विद ईमानदारी, सी द डिफरेंस. आई विल प्रिपेयर यू टू दैट लेवल दैट दुनिया में कहीं किसी भी एग्जाम में आपको तकलीफ नहीं होगी. Tomorrow when we'll be discussing USMLE, right? I'll be discussing all the steps 1, 2, ये OET वगैरह सब डिस्कस करने के बाद the last step is, now this is the last step. Remember, अब तक यहां तक पहुंचने में अपने 20 लाख रुपए खर्च कर चुके हैं, right? What if यहां पे अगर जो फेल हुए, gone. This is what is called as the interview. So I'll prepare you for this right from the beginning. Right from the beginning. Many of you must be very good orators, right? Must be. वो आप बात करते हैं उससे भी पता चल जाता है कि you are pretty fluent, even from your emails also. हाँ हाँ दोस्त, इंग्लिश तो कंपलसरी है ही. मतलब आई डू हैव रिस्पेक्ट फॉर एवरी अदर लैंग्वेज, बट यहाँ तो इंग्लिश. वहां पे आप यूएस के लोगों के सामने हिंदी में तो नहीं बोल सकते ना कि कैसा है भाई, है ना. सो यस, इंग्लिश इज कंपलसरी, क्योंकि ये इंटरव्यू आपका जो फाइनल इंटरव्यू विच विल गिव यू द एंट्री, वो तो इंग्लिश में होगा ना. एंड दे विल बी लाइक पैनल पे बैठे होंगे. मतलब दे विल बी 4 people, 4 guys एंड ऑल टॉप नॉच डॉक्टर्स. तो वहां पे तो आपको तैयार होना ही पड़ेगा. नाउ ऑल दीज थिंग्स, नथिंग टू वरी अबाउट, जरा भी टेंशन मत लीजिए. वन एग्जाम्पल विच आई एम गिविंग, वन स्टूडेंट purely from Gujarati medium, right? Purely from Gujarati medium, but today right now he is at a very big post. 52 people are working under him. Now this is way back, almost 15 years have passed, but yes, possible. So किसी को थोड़ा इंग्लिश में थोड़ा बहुत प्रॉब्लम भी है, बोलने में तकलीफ है, नो प्रॉब्लम. दिस इज लाइक योर होम पिच. यहाँ पे बात करो बिंदास से. 350 लोग हैं, राइट. से रैंडमली, से फॉर एग्जांपल साई सावंत, राइट. मैंने ऐसे रैंडमली एक नाम ले लिया. साई, इन केस इफ यू हैव गॉट प्रॉब्लम इन स्पीकिंग, ठीक है, बिंदास यहाँ पे बोलो. क्या होगा, एट द मोस्ट थोड़े लोग हंस लेंगे ना, है ना. अच्छा है, बिकॉज इट जनरेट्स दैट फील इन द माइंड. बट आफ्टर दैट ना, यू विल फील सो गुड कि चलो इतनी तो हिम्मत की कि बॉस इतने लोगों के सामने मैंने बोला, राइट. दूसरों ने तो जवाब भी नहीं दिया ना, है ना. सो व्हेन आई आस्क एनी ऑफ द स्पेसिफिक क्वेश्चन, डू रिप्लाई, टेक द इनिशिएटिव. दिस इज व्हाट इज आस्क्ड अब्रॉड. they really see that thing, that how much initiative can you really take. जो चुप बैठा रहेगा, जो कहते हैं ना कि ये जो मैंने आपको पूरा पाथ दिखाया, स्टेप 1 क्लियर, स्टेप 2 सी के क्लियर विद वंडरफुल मार्क्स, उसके बाद ओईटी भी आपने बहुत अच्छा किया, देन इलेक्टिव्स यू डिड ऑसम, यू गॉट ऑसम लेटर ऑफ रेफरेंसेस, बहुत बढ़िया ऑब्जेक्टिव, सब अच्छा किया, अच्छा प्लानिंग. देन केम द फाइनल इंटरव्यू और वहां पे आप नहीं बोले, तो दोस गाइज विल से कि ठीक है, व्हाटएवर यू हैव डन, राइट, good, but you are not good for me, because if you cannot talk to patients, तो क्या मतलब, right? So this interview, that is where they will really assess you, can you really communicate properly. और ये जो है, this thing, it comes by practice. Okay, गरिमा, don't worry about it, right? ये जो मैंने आपको बोला ना, ये 20 लाख, राइट. ये 20 लाख मैंने, इट इज ऑन द एक्सट्रीम हायर साइड. एंड आई टेल यू सच एग्जाम कॉस्ट वगैरह जो है कितनी है. दिस इज, ये कल बात करेंगे, राइट. जिसके अंदर एक स्टेज ऐसी है कि जिसके अंदर आपका $4,000 पर मंथ का खर्च आता है, विच इज कॉल्ड एज इलेक्टिव्स. वो 3 महीने की ट्रेनिंग, आपको पेड ट्रेनिंग होती है यूएस में, प्लस रहने खाने पीने का खर्चा, राइट. बट दिस इज नॉट कंपल्सरी. This is not compulsory, it is optional thing. So अभी के लिए don't worry about the money, कि ये वो टेंशन मत कीजिए. ये क्या मैंने ग्रॉस, why I said कि your parents should also be knowing कि मुझे कितना प्लानिंग करना है, right? It is same like you want to buy a BMW, तो yes, it will come at a cost, right? You want to buy a normal car, so then that will be over there. But yes, it is possible to do the journey with every car. Same thing is over here, right? I'll show you many of the shortcuts in the way कि आप अपना पैसा भी बचा रहे हैं and you are increasing the value of your CV. I'll show you the ways, right? पर उसके लिए अभी से तैयारी करनी पड़ेगी. Say for example, गरिमा रायकर, yeah, गरिमा, you said कि yes, the problem is there. Yes, I understand. But अगर जो मैं बोलूं कि गरिमा चलो 200 पेज की ये किताब, विच इज नॉट अपने सब्जेक्ट की चीज नहीं है, पर आपको पढ़नी पड़ेगी, राइट. एंड देन आई टेल यू कि ये एक एग्जाम दो. अगेन ये एग्जाम आपके एकेडमिक्स में कुछ काम नहीं, but this thing will give you the extra points. It will give you the added extra points into your CV. तो yes, this is worth it. खर्च क्या आया? 1,000 रुपया। 1,000 रुपया तो यार अपने पिज्जा में खत्म कर देते कई बार, है ना? सो आई शो यू सच थिंग्स, बट ये ओवरनाइट नहीं होता, ये टाइम टू टाइम जब चांस मिले तो यस आई से कि व्हेन यू आर इन ऑन वेकेशन, वापस आए हैं आप इंडिया, राइट, एंड इफ देयर इज अ ब्लड डोनेशन कैंप तो go help them, right? If it is from Red Cross, so they'll give you certificate. वो छोटी छोटी चीजें they'll all keep on mounting. उसकी वैल्यू आप देखना जब आपका इंटरव्यू होगा, they'll be asking you those questions, right? So there are so many methods to increase the value of CV. मतलब कई बार वो मेरे स्टूडेंट्स को आई टेल यू कि देखो, if you want to have a very good girlfriend or very good boyfriend, तो one method is कि you should be like super smart, बॉलीवुड या हॉलीवुड, मतलब इतने ब्यूटीफुल, इतने हैंडसम, राइट? बट दैट इज नॉट इन आवर हैंड, पॉसिबल ना, इट इज नॉट इन आवर हैंड, बट ये दिमाग, ब्रेन, दैट इज इन आवर हैंड. So make yourself intellectually so rich, and not only rich, you should be able to show that thing to the world. तो बॉस मैं फालतू नहीं हूं, and that will make a big difference जब आपका सीवी बनेगा. So that's why this is a long journey and so many things will be calculated, right? जब आपका फाइनल सीवी बनेगा, and I'll help you genuinely in that कि क्या करना है. But it cannot be done कि सीधा स्टेप 2 सी के क्लियर कर लिया and कहते हैं अब मुझे ये ECFMG में मैंने एनरोल किया, नाउ टेल मी व्हाट शुड आई डू. तब कुछ नहीं हो सकता, कुछ नहीं हो सकता. शुभमन गिल ने कल सेंचुरी मारी, पर बिहाइंड दैट कितना है, कितनी प्रैक्टिस, करेक्ट? व्हाट वी सी इज अ फिनिश प्रोडक्ट. दोस्त, जब आपका सीवी बनेगा यू विल बी लाइक अ फिनिश प्रोडक्ट, पर उसके लिए तैयारी अभी से करनी है. दैट्स व्हाई वो जो मैंने बोला कंसिस्टेंसी, जो भी टॉपिक अपने पढ़ेंगे, राइट, वट एवर वी स्टडी, you have to revise that thing in a way which I'll tell you, right? I did my 12th from Xavier's. So being Xavierite, वो दिमाग में ना हवा भरी थी. I'm telling honestly my experience. दिमाग में हवा भरी थी. Got the admission in BJ Medical College, right? One of the finest in India. Very happy, right? पढ़ाई छोड़ दी. Why? कह रहे टेबल टेनिस खेलना बहुत अच्छा है, टेबल टेनिस खेलो, पीछे आर्मी कैंटोनमेंट, वहां जाके हॉर्स राइडिंग करो, राइट, आर्मी लोगों के साथ चलो, दौड़ने गए, पढ़ाई छूटी. एंड वाई? दिमाग में एक हवा भरी थी, राइट, वेरी इगोइस्टिक. कह रहे मैं तो ये जो है ना ये आराम से फिनिश कर लूंगा. रिजल्ट केम आफ्टर 6 महीने के बाद, एग्जाम हुई, रोना आ गया. देन रियलाइज कि नहीं बॉस, दिस इज नॉट दैट थिंग कि एक बार पढ़ा और याद रह गया. नहीं रहता याद. The muscles, the nerves, arteries, these things are not tricky, but they require proper focus. So that's why I'm telling you the consistency. रोज थोड़ा थोड़ा थोड़ा. I don't want any of you to be rabbits. नहीं चाहिए मुझे, कोई फास्ट लोग नहीं चाहिए, मुझे I want all कछुए चाहिए. रोज एक स्टेप, right? Remember Bruce Lee, right? All of you must be knowing Bruce Lee, right? He's my favorite, one of the finest. He's the best. He was the best in martial arts. उसका जो एक सेंटेंस है ना, that I am not afraid of a person who can kick in 100 different ways, but I'm very much afraid of a person who can kick once, but he has practiced that kick 100 times. So same thing is over here, the consistency. So that's why those random exams. Random exam में क्या होगा? अचानक एग्जाम आए, so it will prepare your brain कि रात को नींद में भी पूछो तो ये सब्जेक्ट आना चाहिए. That's the whole idea. So this will be like an army training, right? कभी भी. And अभी तो things are very comfortable, but आगे जाके देखना, रात को 2 बजे भी मैंने ट्रेनिंग ली है जानबूझ के. कि देखते तो हैं कि रात के 2 बजे कौन माइका लाल जाग के आता है कि चलो सर पढ़ते हैं. I teach even IT also. Right, one of my student, right, he is right now in Australia. That student, उसकी शादी थी. He came, he said कि सर लड़की देखने आया और मुझे पढ़ाई करनी है. Cisco, he wanted to study Cisco. Giving you the example just to show the dedication of a person. Started the training of Cisco Certified Network Professional, CCNP. Now this is a training in which there are 4 papers. उसने 2 पेपर क्लियर कर लिए and then he got a very good girl. पर the thing is कि सिर्फ 1 वीक के बाद शादी. ठीक है. he जिस दिन शादी थी उसके 1 दिन पहले भी आया था and he said कि सर कल नहीं आ सकूंगा, मैरिज है, शादी है मेरे. मैंने कहा ठीक है, नो प्रॉब्लम. शाम को रिसेप्शन था. रिसेप्शन पे ऑन द स्टेज व्हेन आई वेंट, तो ही सेड कि सर कल कितने बजे आना है. आई सेड मैन, कहता है हाँ सर. और कहता है ये मेरी वाइफ, आप उनसे पूछ लीजिए. शी सेड कि हाँ सर, हम कहीं घूमने नहीं जा रहे. राइट, लेट हिम फिनिश दिस थिंग, घूम तो बाद भी लेंगे. एंड ही कंटिन्यूड. 1 महीने में he finished rest of the papers. Now today he is into Hewlett Packard and he is at a very senior level, and still he remembers when he comes to India, he tells के वो कैसा टाइम था. मैंने कहा यार that is your dedication. बस you give me this, you show this dedication, I'll give you everything, whatever you want. Past experiences नहीं अच्छे. It happens like आप जब तक इंडिया में हैं, right, again not complaining, but all the students they were very good. But जैसे दूसरे देश में जाना शुरू हुआ, suddenly पूरा सिनारियो चेंज हो गया. The presence जो अभी 400 की presence है, it started dropping. It dropped to such a pathetic level कि हमें लेक्चर बंद करने पड़े. My heart breaks कि अरे यार ये क्या कर रहे हैं लोग. And then when I listen, जब उनके मेल आते हैं कि सर वो दारू पिया, ये किया, रिजल्ट खराब आया, and then they cry and then they say कि अब क्या कर सकते हैं. So can ये मैंने लास्ट बैच से भी प्रॉमिस लिया था पर उन्होंने तोड़ा वो प्रॉमिस. Can I get that promise from you? कि कोई तकलीफ हो तो बता दीजिए कि मुझे 10 बजे कन्वीनियंट नहीं है, कोई बात नहीं.
Yes, sir.
Yes, sir. Sure, sir. Sure.
Yes, sir.
When we decide,
Sure, sir.
जैसे सपोज आप कॉलेज में गए, क्योंकि कंट्री में टाइम डिफरेंस भी होगा, we'll adjust
Sure, sir.
everything. आप जो बोलोगे सब एडजस्ट करेंगे. रात को आप ऐसे कहेंगे कि सबका कॉमन टाइम रात को 1 बजे सेट हो रहा है, मैं जागूंगा, आई टीच यू. रात को 1 बजे से 3 बजे तक लेक्चर होगा, नो प्रॉब्लम्स. बट ये नहीं होना चाहिए कि यू गलत रास्ते पे चले गए. आई रियली वॉन्ट कि सभी के नाम में कि डॉक्टर ध्रुव मात्रे, यस डॉक्टर लिखा चाहिए, डॉक्टर साची मौर्य चाहिए, डॉक्टर निशा दलवी चाहिए मुझे. राइट, दैट वे आई रियली वॉन्ट ऑल ऑफ यू. सो कुछ भी whenever you feel like कि नहीं मुझे ये कोई प्रॉब्लम है, do tell about it. Now that is a very smart 345. Now I won't be able to read all the emails, but many of you have sent the emails with the promise. Very nice, very nice. मतलब it is like देखो, I won't be able to remember everyone's name, है ना? But just consider that it is like one-to-one connection between you and me. Yes, yes. अच्छा, I think कोई बात नहीं. अभी अब मैं नाम नहीं ले रहा क्योंकि ये सेम टॉपिक काफी लोगों का है कि इधर इंग्लिश में फंबल कर रहे हैं या इंग्लिश में तकलीफ है. कोई बात नहीं. I said that this is like a home pitch. When I ask you, we'll be conducting some of the oral examination also. So I'll ask a question and randomly I'll say, okay, Varad, speak. So now it's like you have to answer, right? मतलब अभी में प्रश्न, हाँ अभी भी आपको बोलना हो तो कुछ बोल सकते हो. At least I hear few of the voices.
Yes, sir.
Chalo, Varad, tell me something about you.
So
Today
my
is the
name-
warm-up session.
My name is Varad Avinash Upadhyay. I'm from Maharashtra, Kolhapur.
Uh-huh. Listen, let me raise the voice. हाँ बोलो बोलो. Go ahead, go ahead.
Nothing much, sir.
क्या nothing much? यार इतने smart होंगे. You must be very smart, right?
Yes, sir.
हाँ तो that shows the confidence.
Great to have you, sir.
अरे, that's my pleasure. Thank you so much. Who will introduce himself or herself? And बिंदास यार अपनी value अगर जो
So I will.
हाँ yes go ahead. दोस्त अपना नाम
Good.
ये Zoom user तो मुझे लगता है कि मैं किसी alien से बात कर रहा हूँ.
Sorry, sir. Good morning, everyone. My name is Mizan Ansari and I am from Mumbai, Maharashtra.
Okay. ये तो क्या ये तो आपने मुंबई की एडवर्टाइजमेंट की कि मुंबई में इतने स्मार्ट लोग रहते हैं.
No, sir.
Say something about yourself. अच्छा रुको. Ritu, I think you unmuted yourself. I could see that.
Yes, I did.
Yes, go ahead.
Good morning, sir, and good morning, everyone. Myself, Ritu Kakati. I am from Mumbai, Maharashtra, obviously, and I actually wanted to ask you a doubt, sir.
Go ahead.
So where can I find your email ID to just ask my queries about the classes and everything?
Sorry, can you repeat your question? Email address?
Yes, sir.
This is the email address.
Okay.
I think you must have joined bit late because this is the email address. It is TILLUR Mbbs. So very thoughtfully I created this email address, considering that yes, I'll remain connected with you till you are MBBS. क्योंकि उसके बाद तो आप भी डॉक्टर बन जाएंगे तो तब आप बहुत बड़े आदमी मत बन जाना कि फिर अब बात
No, sir.
ठीक है. Just
Yeah.
kidding. So this is the email address till you are mbbs@gmail.com. Yes, anyone else wants? Yes, Suncha, go ahead.
Hello, sir.
Hello.
My name is Swapnaja Rakesh Mamunkar, and I live in Maharashtra, Mumbai, and I have great interest in studying, and my passion is medicine.
Medicine. Any specific field?
Gynecology, in gynecology.
All right. Yes, Vedant.
My name is Vedant Guru and I'm from Thane, Maharashtra. My hobbies are working out and playing guitar. And I'm also interested in medicine and like reading obscene medical cases.
All right.
Yes.
Good. Yes, Pratham. Now the things are picking up. Good.
Yes, sir. Myself, Pratham Guge. I am from Nasik, Maharashtra. I just completed my 12th this year, and I'm interested in medicine, especially cardiology field. I'm most passionate in that.
Good. Right. Yes, Tanvi.
Good morning, sir. I'm from Thane, Maharashtra. Myself, Tanvi Gupta, and I have a very fascinating thing about gynec in specific field, and I want to be a MBBS doctor, but there is something coming anxiety, or we can say something. If we go to abroad, will we able to adjust there or something like?
So that is very obvious. Even when we change the city, right? It happens like that. Over here, so you'll be changing the country. Second thing, Tanvi, when you said that after you want to go into the field of gynec obstetric, right? So that is a post graduation, correct? So it is not only that at the level of MBBS you are stopping, you are going much ahead, right? And when we'll be discussing the embryology, right? When we'll be discussing the embryology, that is the formation of the baby. So when the ovum and sperm meets, the journey starts from that point until the process of delivery. The entire thing is so fascinating that take my word for it, कितनी बार ना अपनी आंख में आंसू आ जाएंगे कि यार भगवान है या नहीं है पता नहीं. But this is something which is like amazing thing which is getting created by the God. everything is so planned, so proper, and how the heart forms, how the chambers develop, how the walls develop. And when you learn that process, right, it will take you to that level when you'll fall in love with medicine. And once you fall in love with medicine, मतलब अपना अच्छा बढ़िया गर्लफ्रेंड हो या अपना बॉयफ्रेंड हो, तो कितनी सारी बातें की उसके साथ, पता नहीं चलता ना कितना टाइम गया. बस then this medicine will become your boyfriend or girlfriend. Then the time thing will stop. पता ही नहीं चलेगा. And एक्चुअली इट वुड हैपन कि कोई भी चीज आपने एक बार पढ़ी और वो दिमाग में घुस गई, याद रह गई. रिवीजन तो वो कहने की बात है, अदरवाइज तो पता ही था. राइट, इट विल हैपन लाइक दैट.
So
Yes.
there is some kind, something like a nagging thing. Will I able to crack it, or something like the fear of being failed or something?
Okay. अच्छा, so many hands have been raised, पर I'm asking one common question to everyone, right? No, emails are also, हाँ ठीक है, मतलब I'll reply to every email, अभी नहीं, I'll reply to every email. Now I won't be able to even read all the emails because now it has crossed the entire page. A common question, what Tanvi said, किसी को अपने पे डाउट है कि यार मेरे से होगा या नहीं होगा? Be honest.
No, sir.
No, sir.
No, sir.
Not yet.
No, sir.
Sir.
No, sir.
Doubt.
No, sir.
Wait. जिसको है ना वो बोले and be honest. अरे मुझे ही डाउट था. मैंने जब एडमिशन लिया तो I was very confused.
Yes, sir.
Yes, sir.
हाँ, बस होना ही चाहिए. क्योंकि जब डाउट हो ना, तो then we prepare ourselves very properly.
Sir, even I have a doubt, but I'm confident that I'll make it.
वो बात अलग है. That is totally different. मुझे तो अभी 9:55 को ही डाउट था, पता है कि यार इतने लोगों के सामने मैं बात कैसे करूंगा. I was very confused. फिर कॉफी पी, उसके बाद फिर मैंने बोलना शुरू किया. The thing is that self-doubt, right? Partial self-doubt. It is not doubt, but it is what is called as the anxiety. जब अपने psychiatry पढ़ेंगे ना, we'll be discussing this thing in lot detail. In fact, this is like a very protective phenomenon. Otherwise, you go, मतलब बहुत ज्यादा confident हो जाते हैं, तो that is also bad. वो गिरते हैं, right? Anxiety, little bit of anxiety, it improves your performance. Now, there are all the chances that आप में से कितने लोग, they might be the stage artist, जो stage पे गए, as you said that you play guitar. Now, if you're playing guitar on the stage, yeah, up stage पे, if you are speaking to a good audience, तो दिल में थोड़ा धक होता है, heart rate थोड़ा बड़ा, right? But once you start, उसके बाद suddenly your entire aura changes. Same thing is going to happen even in your medical exams. Examination hall में जाने से पहले, before starting the interview, yes, all these things will happen. Your sympathetic system would be triggered. Heart rate थोड़ा ज्यादा, blood pressure check किया तो थोड़ा ज्यादा, right? You might be perspiring a bit. There is confusion, right? पेट में गुड़गुड़ हो रहा है, right? Yes, it will happen. But then, as you will perform, suddenly you will find that all those things will start disappearing. वो कब होता है? When do they start disappearing? When you have practiced. So that's the reason that we'll be practicing it over here. Yes, we'll be talking about all the books and everything, right? अभी मैं इसके बारे में बात नहीं, शायद yes, super specialization tomorrow we'll surely be talking. I'll merge that topic with the अपना USMLE का, right? When we'll be discussing USMLE ना, तो उसके साथ I'll be merging this specialist super specialization. हाँ, super specialization is even after that. I'll take that, right? So coming back to this, so this is the anxiety. Don't have to worry, don't have to doubt upon yourself. ठीक है? So बिंदास तन्वी, जरा भी टेंशन नहीं. और जिसने भी हाँ बोला, yes, मैं आपके साथ. I was also having very much doubt on myself.
So the thing like heart is saying we can do it, we will do it, but the brain is telling, will you able to do it, or something. The consistent thing nagging about the things are going in the life. And
देखो दोस्त, ये पता है क्या है, मतलब जो when people say ना कि कई बार वो let's say गर्लफ्रेंड इज वेरी गुड, राइट, और माँ बाप कहते हैं कि अरे क्या इसके अंदर नहीं दिखता, इसको ये नहीं आता वो नहीं आता, तो ये क्या हुआ, हार्ट, राइट, हार्ट इज टेलिंग कि नहीं नहीं माय गर्लफ्रेंड इज वेरी गुड, ब्रेन कहता है कि नहीं यार इससे अच्छी मिल जाएगी, नहीं नहीं, बट ये हार्ट बोलता है ना. द थिंग इज योर हार्ट इज टेलिंग कि दिस इज गुड, राइट, ब्रेन इज टेलिंग कि नहीं, डाउटिंग ऑन योरसेल्फ. ये वॉर तो पूरी जिंदगी चलेगी, पूरी जिंदगी. It will keep on occurring for the whole life. You have to take a call when to listen to heart and when to listen to your brain. So tomorrow, I'll be giving a practice to you, and ये practice will, वो 10 मिनट की practice होगी. It will be a practice of just 10 minutes, and ये 10 मिनट it will be with the explanation. Otherwise आपको दिन के सिर्फ 3 मिनट निकालने हैं, just 3 minutes. बट ये 3 मिनट कब तक, तब तक जब तक आप एमडी या एमएस नहीं हो जाते, तब तक. दैट मीन्स आई एम टेकिंग अ कमिटमेंट फॉर 10 साल, 10 years, रोज 3 मिनट. आप पूजा नहीं करेंगे, या से सपोज आप ये जो भी धर्म में है, राइट, इट इज फॉर एवरीवन. भगवान के पास, अल्लाह के पास नहीं जा रहे, नहीं हो रहा, चलेगा, नो प्रॉब्लम. बट इफ यू डू दिस 3 minute, God will be happy. God मतलब आई एम टेलिंग इन जनरल, मतलब हिंदू मुस्लिम सिख ईसाई सब आ गए. आई एम नॉट टॉकिंग एनीथिंग जनरल. प्रथम, यस, थैंक यू, दैट इज वेरी नाइस ऑफ यू, वेरी नाइस. अच्छा, सो ये 3 मिनट, दिस इज द प्रैक्टिस विच विल बी परफॉर्मिंग फ्रॉम टुमारो ऑनवर्ड्स. इवन जिस दिन अपने नहीं मिल रहे, राइट, उस दिन भी आप ये प्रैक्टिस तो करेंगे, and you'll see the difference. अच्छा, yes साक्षी, फटाफट, राइट, सबसे कुछ ना कुछ तो सुनना ही है. साक्षी पवार, सो मुझे नाम पता है आपका, राइट, सो नो नीड टू टेल मी योर नेम. मस्ट बी फ्रॉम मुंबई, और कहीं से है तो बता दीजिए. व्हाट डू यू लाइक, व्हाट आर योर हॉबीज?
Sir, I like reading books and I am interested in psychiatry.
Very nice, very nice. Psychiatry is one of my favorite, right? So जब psychiatry पढ़ेंगे, we'll be discussing all the cases, ऐसे cases, right? ऐसे cases. Obsessive compulsive disorder, obsessive
OCD.
compulsive OCD. ये तो एक ऐसी, इसके अंदर तो केस पे केस भरे पड़े हैं. मतलब आई वॉच टीवी, मतलब खूब, मतलब कितने, एवरीडे आई वॉच एटलीस्ट एक मूवी, सारी सीरियल्स बोलो, विंबलडन सब देखता हूँ, राइट, एवरीथिंग. मतलब आई गॉट मल्टीपल स्क्रीन्स ओवर हियर. तो इट हैपेंस मेनी टाइम मूवी चल रही है और यहाँ पे ये मेंस डबल्स जो कल शुरू था, तो एक स्क्रीन पे मैच चल रही है, क्योंकि वो तो स्कोर देखना है ना. तो पैरेलली आई कीप ऑन डूइंग, बट यस आई वॉच. और अभी राम कपूर की जो सीरियल, राइट, एनीवन हु इज वाचिंग इट?
Yes, sir.
कौन सी? In which he is police consultant, detective.
Mystery, I think, sir.
Mystery, yes,
Mystery.
sir.
Correct.
Mystery.
Now he has got that, right, that trauma, and he has got that OCD also. So इसलिए हर एक चीज बड़े ध्यान से साफ करना, जरा सा भी, इवन मिस्त्री में, राइट, वो आर ऐसे लिखा है एंड देन दैट आर गेट्स करेक्टेड एंड वो ऐसे आ जाता है, राइट. दिस इज OCD. एवरीथिंग शुड बी वेरी परफेक्ट. इन मेडिसिन जब अपने पढ़ाई करेंगे, it is not expected that you should be very perfect. No, it is not possible. छोटी चीजें याद रखना पॉसिबल नहीं होता, वो खुद याद रह जाती है when as you will be taking it into practice. So this thing will be very effective when we'll be learning about ECG, when we'll be learning about auscultation, that is when you hear the heart rates, etc. Right? वो सब आएगा. Yes, Arush Raj Chug, right? I hope मैंने ठीक नाम लिया.
Yes, sir. Good morning, sir.
Good morning.
सर फर्स्टली आई प्रॉमिस कि मैं आपके साथ हर एक लेक्चर्स ज्वाइन करूंगा.
शाबाश.
एंड सेकंड ऑफ ऑल सर, आई हैव माय एग्जाम टुमारो एट 10 AM on Saturday, sorry.
Okay.
So can I get a permission to record the meeting or can we just postpone the meeting.
एग्जाम कितने बजे तक है?
10 to 2.
अच्छा, 10 to 2. ठीक है. We'll do something because see, we cannot shift everyone, na?
Yes, sir. Because
but
that's
we'll
why
find
I
out.
asked कि can
हाँ.
I
आप
get
मुझे
the
ना
permission
just
to record?
कोई बात नहीं. No
Okay,
problem.
sir.
No problem.
And sir, I'm interested in cardiology for specialization.
Nice. तो very soon you'll be very happy.
Yes.
मतलब बस next month ही cardiology आ जाएगा.
Oh, wow. Thank
Yes,
you.
Ridhima.
Hello, sir. I'm Ridhima Gupta. I'm from Thane, Maharashtra. I passed grade 12 exam last year, and I took 1 year drop for NEET. But originally, I did not plan to study abroad, but I guess situations. And then, as for interest, I'm particularly interested in psychiatry.
Okay.
As for hobbies, I'm interested in dance. I have learned Bharatanatyam, the classical dance form, and
Nice.
gymnastics.
Now see, those who are dancers, those who are into music, right? I do have two synthesizers. One Yamaha and second is the big Cassiopeia. Now, when you are into music, it automatically generates so much of discipline. So same thing which you have to implement. Plus few of the emails which are there. One is from Pranjal. I'm just only some of the part and you didn't score well. Don't worry about it. ये जो था अब तक का जो था just that is past, right? Past को पकड़ के रोते रहे तो यार आगे क्या होगा? So जो हुआ सो हुआ. कम मार्क्स आए, no problem, बात खत्म. Forget about it. This trauma, ये आपके दिमाग पे कोई असर नहीं करना चाहिए. It is like this is like a new birth. It is you are like a newborn. बस ऐसा ही सोच के चल. So कोई भी doubt कुछ नहीं. No, don't doubt on yourself. नहीं कोई जानवी कुछ difficult नहीं है. Will you be teaching PLAB? Yes. USMLE. अच्छा, let me be clear. USMLE, PLAB, ऑस्ट्रेलिया की एग्जाम, ये सब के लिए will I be teaching all of them? देखो, human body will remain same, right? सबका same ही है. So course also remains same. The difference is ये लोग questions कैसे पूछते हैं, right? So yes, ये मैं इसका आंसर बोलूं ना तो इसका आंसर कि मैंने Xerox की दुकान खोली और and what if I write we Xerox in all languages. ऐसा होगा. Those courses तो सेम ही है ना. It is the same medical thing. सब जगह सेम है. ऑस्ट्रेलिया में थोड़ा उनके 2 लीवर होते हैं. एंड यूएस वाले जो हैं उनका ब्रेन 1600 ग्राम से बढ़ के 3500 ग्राम. सेम. So ये तो मैं बोलूं हाँ I'll be teaching you USMLE, I'll be teaching you PLAB, AMC. Yes, it is like we Xerox in all languages. No problem. किसी भी लैंग्वेज में ले
But
आई.
sir,
हाँ.
the complication level would be different, right? For every country, if we talk about the UK, that is PLAB or USMLE and everything.
ना complication, it is like देखो जब इंडिया में पढ़ रहे हैं ना, when we'll be studying, तो as such the course material remains same. In US, you will find the infectious disease, right? They are very less. Infectious disease बहुत कम है. They are more related to psychiatry और वो चीजें ज्यादा है. In India, infectious diseases, they are very high. But जब आपका कोर्स है, जब आप पढ़ रहे हैं, the course curriculum, that includes everything. It is like even in USMLE, they ask hell lot of questions about the infection. Though it is not very common, but as a doctor, one should know, right? The only thing which will come into picture is कि when you practice, जब आप practice करेंगे, तो there you have to be very sophisticated, right? USA में, UK में, they give so much emphasis on that, right? Every time you have to say कि okay gentlemen, how are you feeling today? This, that, और यहाँ पे patient हाँ बैठो, तकलीफ, वो पेशेंट ने जैसे बोला कि सर मैंने कल मूली के पराठे खाए थे, उसके बाद फिर अरे ठीक है, मतलब राइट हियर यू सिविल हॉस्पिटल में देखो यार, 4 घंटे में वी वर वॉचिंग अबाउट 100 पेशेंट्स, एक पेशेंट को 2-3 मिनट दे सकते हैं. यू हैव टू रियली राइट सो फास्ट, फटाफट डायग्नोसिस, अरे इसको इसके लिए भेजो, सिस्टर इसका एक्सरे निकालो, धबा धब चल रहा है. While in US suddenly everything is so sophisticated, right? अब यहाँ पे आप बोलो कि आइए नटवर भाई कैसे हैं, मजे हैं, कैसे घर पे सब बढ़िया, कर चुके हैं काम, right? Not possible. So that thing will change. Over here तो you
So we need to master those skills right there, right, sir?
So yes, but when you'll be studying all the topics, but in practice things will matter very different.
Sir, actually, I have a doubt.
Go ahead.
Sir, myself, Felicia Smith. Actually, I've been scrolling a bit online, and there's some information going around about the new NMC guidelines that says that the country that we did MBBS from, we're supposed to have a license to practice in that country. Could you let me know a bit about that, please?
Yes, we'll talk about that thing in depth tomorrow. But one thing, what is called as the WDOMS. Say, for example, if you want to go to US and you want to practice over there, wherever in whatever the college you take the admission, but that college should be registered under WDOMS, World Directory of Medical Schools. Now, if it is not, so then big problem. Fortunately, all the colleges, right, wherever you are getting the admission, all of them, they are registered in WDOMS. If you really want to check it, you can just check it on wdoms.org, World Directory of Medical Schools. Your colleges, they will be over there. And there would be one number, it is called as the FAMER number. So that FAMER number is what you have to enter when you will be going for ECFMG. ECFMG is Education Council of Foreign Medical Graduates. Ye registration, this is compulsory. Ye karna padta hai when you are going abroad. So what they will say, you complete your MBBS and then during your MBBS, you have completed step 1 and step 2 CK. Yeah, this I'm telling you very briefly. Tomorrow we'll be elaborating more on it. But ye aapne complete kiya. And after that, if everything is going fine, you go ahead and you reach till the level of interview and you start practice, you start working in US. No one would be asking you that, what have you done in India? No, nothing. Right? So, when you come to India, if you are from Indian Medical College, then 1 year internship is what has been made compulsory. Because over here, if it is government college, so then the fees is so less. It is so less. But tomorrow you'll be getting even more answers about it. Yes, anyone?
Okay, thank you, sir.
Most welcome. Yes, Atharv, फटाफट अब ना सबको सिर्फ आधा मिनट ही देना पड़ेगा. Atharv, then Ria, be ready. Ritu, be ready. Hansika, you'll be in queue. You are in queue. Yes, go ahead.
Good morning, sir.
Morning.
I am Atharv Khandade from Nagpur, Maharashtra. I want to do specialist in cardiology.
Okay.
There is some reason for this because there is one case in my home that my grandmother is suffering from cardiology. Heart attack.
I understand.
And when I saw the doctor and his work, I decided to become a cardiologist.
दोस्तों तो ना तुम्हें जादू जैसा लगेगा कि यार क्या मतलब ये ईसीजी जो है जस्ट इतना देख के हाउ डू दे से क्या रे इसको हार्ट अटैक आया. दिस इज वन ऑफ द मोस्ट फैसिनेटिंग थिंग. जब मैं मतलब ईसीजी वेटेज इज 3 मार्क एग्जाम में, बहुत कम वेटेज है, पर ये ईसीजी फैसिनेट्स, मतलब थोड़ी स्टाइल मारने में भी अच्छा लगता है कि वो यूं देखा, अरे इसको ये है, पेशेंट और उसके रिलेटिव्स दे से कह रहे यार क्या जबरदस्त. बट इनफैक्ट इट इज जबरदस्त. It is like a magic. मतलब once you understand the ECG very properly, तो आपके दिमाग में पूरा पिक्चर बनना शुरू होता है कि कैसे ये ST elevation हुआ and which lid, so which side of the heart or which chamber of the heart, which wall is affected. It is a very fascinating thing. Great. Yes, Ria.
Oh, hello, sir. Good morning.
You are Ria Kurhade. Am I
Yes.
right?
Yes, yes.
Bolo.
Sir, actually, I had one doubt that I gave NEET this year, but I didn't score much that I expected. So, due to circumstances, I had to choose MBBS abroad. So, I had one doubt that are FMGs really considered inferior to the Indian medical graduates?
So your concern is about FMG?
Like foreign medical graduate students are considered inferior to the Indian medical graduates.
Inferior क्या होता है दोस्त? What is inferior? Arya, inferior क्या होता है?
Like the clinical exposure that Indian students get
Totally
is
agree.
much more.
Totally agree. Say for example, यहाँ पे मतलब when I'm telling you in civil hospital, right? BJ Medical College Civil Hospital, तो हम रोज के 150 पेशेंट देखते थे. Yes, exposure that would definitely be less, no doubt about it. But that is the reason when you come back to India, मतलब जब vacation होगा, when you will be coming back to India, तो why to watch Netflix? Chalo, right? We are planning something very seriously even for that. So very much possible. And once your foundation is clear, once you are good in the diagnosis, and फिर देखो मजा.
Okay.
Is that when you'll be going to these colleges, right? Initially you are just watching that other doctors working, but then you start diagnosing, and then you start getting the confidence. So no one is inferior. नहीं, वो तो मैं मानता ही नहीं.
Okay, thank you, sir.
Not to worry. But and it is good that you asked this question.
Right? Yeah, thank you, sir.
Very clear. Yes, Hansika, you're next.
Hello, sir. I'm Hansika Savani from Nasik, Maharashtra. And sir, I'm interested in pediatrician. As I've seen my family doctor practice it, and I really love his work, how he treats children and all that. Apart from studies, I love baking. My passion is baking, and I've started selling cakes and cookies during the time till I get admission. Also, I'm interested in dance.
You are from Nasik, no? I'll come to Nasik because I love cakes.
Okay, yes, sir, sure. Thank you so much.
And pediatrics के लिए बढ़िया चीज एक बात बताऊं.
Yes, sir.
During our pediatric rotation, I told my sir कि सर ये तो बड़ी अजीब चीज है. अपना पेशेंट तो एक ही लैंग्वेज बोलता है. उसके ऊपर से डायग्नोस करना किसको पेट में दर्द हो रहा है या क्या प्रॉब्लम है. So yes, it is exactly like that. Great. Yes, Samarth. Yes, Samarth.
Yes, sir. Good morning, sir. Sir, I'm Samarth Bhakre from Pune, Maharashtra.
Yes.
And sir, if I talk about a particular subject that I'm interested in medical, it is about immunology and cancer.
Okay.
Yes.
So you said cancer, and what was the first part? Criminology?
Immunology, sir. Immunology.
Immunology.
Yes, sir.
Are superb. Madam, in immune system, right? This would be like a defense system. Very grossly, I'm telling you that immune system is like our Operation Sindoor, right?
Yes, sir.
Two parts. One part, which is the first line of defense. That is the first line of defense. कुछ भी हुआ, कुछ नहीं देखना. Who is attacking? जाओ जाके मारो. And then when we watch specifically, right? So it is like during that attacks के चलो drone का attack आया. So we can't वो पाकिस्तान के 2 लाख के ड्रोन के लिए अपने S-400 शुरू करो तो one firing is 60 crore. तो ये कहाँ का इंसाफ, right? So that's why all those field guns were used. That is the first line of defense. कुछ नहीं देखना, जो shoot that, right? But then specifically some of the powerful drones, as they entered, then we started what is called as the specific things. So immunology is exactly like that. And then when you will be deciphering all the immunoglobulins, right? IgG, IgA, IgM, IgD, IgE, it is so fascinating. Very nice, right? And cancer, तो उसके लिए तो time कम पड़ जाएगा. Very nice. All right, who is next? Ananya, go ahead. Ananya, are you there?
It's actually Anaya, not Ananya.
Oh, sorry, sorry, Anaya.
Yeah, that's fine. I'm from Mumbai, Maharashtra.
and I'm more interested in surgery, especially cardiothoracic surgery. Because the reason why I'm interested in cardiac is because if a person is brain dead, it is not technically alive, but still the person is alive. But when a heart stops, a person is actually dead. So that's a organ which I would say is more critical in our entire body. That's why I'm more interested in it.
Great.
And it fascinates me a
India,
lot.
yes, that's true. That's the
Thank you.
difference between India and USA. In India, in USA, if the brain is dead, person is declared as dead. In India, when the heart stops, then the person is considered as dead. Yes, I think I got your message also. Your microphone is not working. No worries. Right? Interested in neurology? Great. Good one. Right? Next exam will be same for foreign and Indian students, or exam pattern will be different. No, next is next. It is same for everyone. Right? It is same for everyone. Then what is that? There is so much of negativity about MBBS abroad. Okay. Okay. Yeah, that is true. People have got very wrong concept and notions for those students, those who are doing MBBS abroad. मतलब ये कहते हैं कि अच्छा आप बाहर कर रहे हैं and suddenly they decrease the value. देखो, this is common for everyone. वैल्यू आप अपनी कितनी करते हैं, दुनिया आपकी वैल्यू उतनी करेगी. राइट? एंड दैट्स द रीजन कि अगर जो किसी को ऐसा लगता है कि यस वहां जाके राइट वी आर बिट इंफीरियर टू इंडियन मेडिकल स्टूडेंट्स, तो आप भी इंडियन ही हो. द ओनली थिंग इज कि यू आर स्टडिंग अब्रॉड. राइट? यू आर नॉट कोई दूसरे दूसरे प्लैनेट से आए हैं. यू ऑल आर इंडियंस एंड इट शुड बी रिस्पेक्टेड. Right? But situation, everything is circumstances are different. Doesn't matter. It happens. It happens. That's why as you will proceed in your career, see the difference. Right? Achha, so many emails, won't be able to answer all of them now. Okay. Now, अच्छा चलो अब I think चलो श्रीराज फटाफट अब we have to just pick up fast.
Good morning, sir. My name is Sriraj.
Yes.
I am interested in gastroenterology because in India most of the people suffer from digestion issues, and that's all.
So gastroenterologist.
Yes.
Very nice. Great. Sanyukta.
So hi, my name is Krishna. My hobbies are eating, swimming, and playing basketball, and I'm interested in psychiatry.
Sorry, Sanyukta. I'm unable to hear you properly. Voice is very low. रोज एक काम करो ना, ईमेल भेज दो ना. सेंड अ ईमेल. ठीक है, जस्ट सेंड अ ईमेल. ठीक है. हाँ, प्रांजलि.
Hello, sir.
Yes, sir.
Go ahead.
Yes, hello everyone. I'm Pranjali Phatak and I'm from Dharamshi, Maharashtra. I've just completed my 12th this year itself, and I'm really excited to be here and to start this journey in medicine. And if I talk about a specific field, so I'm interested in cardiology.
All right. See, one thing I noticed, English of all of you is pretty good. You won't be having any problem in any of the interviews. थोड़ा कॉन्फिडेंस की चटनी अंदर डाल दी तो इट वुड बी अ टेस्टी थिंग. सो ग्रेट. अच्छा श्रीराज, आपने बोला या बाकी है? बिकॉज योर हैंड इज रेज्ड. ओके यस वेदिका, फटाफट.
Right. First of all, sir, salute to you. I deeply respect all the doctors who are working for humanity. My interests are quite vivid, I would say. I'm interested in cancer. At the same time, I'm interested in neurology. However, there's a doubt here, sir. Particularly when we talk about all these neural diseases, I'm more inclined towards finding a cure, as in trying to be a scientist apart from being just a doctor. So, is there a particular way or a pathway that we can proceed with this?
Yeah, definitely. Say finding a cure, that means it is what is called as the research field, correct? You'll find lot more opportunities. And in order to do the research properly, your foundation would be very important. And as you said, the urology and the cancer. Well, these are the kidneys.
No, sir, neurology, my bad.
Achha, neurology. Okay. So even in that case, let's say this is the brain, right? Cerebrum, cerebellum, small brain, and over here we have got the medulla oblongata, pons, midbrain, and then that's the spine, right?
Right.
Brain and heart. These are the two organs in the entire body. If anything happens to them, they are gone forever. This is the reason that if someone has got a heart attack in past, for rest of his life, you take the ECG, you'll be able to see that yes, he has got the past myocardial infarction or the heart attack. MI or the myocardial infarction is the medical name for heart attack. But that thing will remain there. Similarly, any part of the brain is damaged, it remains damaged for rest of the life. That's why these are the two areas, neurology and the cardiology, they play a vital role in anyone's life. Because once they are damaged, nothing can be done. That's why we really want to prevent that damage. Right? So good one.
Sir, can I?
Yashasvi.
Hello everyone. Good morning, sir.
Morning.
I'm Yashasvi. I'm 17. Just completed my 12th. For a specific field, I'm very fascinated with the human brain. I'm very interested in psychology, neurosurgery, but I'm very dividing interest. Like I am interested in everything, but I feel like I would like to go into what I am good at.
Yes. See, a very crude comparison. बस बाकी के लोग प्लीज म्यूट रखो. ये क्या मतलब दिस इज ना मेल, देयर इज अ मेल ब्रेन एंड फीमेल ब्रेन, वो दोनों ना अलग अलग तरह से चलते हैं. व्हेन आई टीच साइकियाट्री ना, तो मतलब दिस इज लाइक ऑल द मेल्स, राइट? ऑल द मेल्स बेसिकली ना, वी ऑल आर वेरी बुद्धू. सीरियसली, देयर कैन नॉट बी एनी अदर वर्ड. वी ऑल आर वेरी बुद्धू. मतलब किसी लड़की ने स्माइल दे दिया तो अरे बाप रे, राइट? मतलब उस दिन तो खाना मिला नहीं मिला चलेगा. वो बस स्टॉप पे किसी ने मतलब जरा सा हाथ रख दिया तो 2 दिन तक तो हाथ नहीं धोया, राइट? इट हैपेंस, राइट? Females, they are very smart. And actually, physiologically, when we'll be studying, females are very smart, right? They won't be going at your looks. They won't be going at your money. You know, their intelligence level is much higher, right? It is a true fact, right? It is a true fact. और इतने सारे मतलब जब लोग खुश हो रहे हैं तो बात सही भी है, correct? It happens. The neurology is such a thing. Neurology is such a thing. And as you will proceed into your medical studies and the psychiatry, इतना मजा आने वाला है, इतना मजा आएगा. You will find कि अरे यार, these are the things what जो अपने पे हो रही है, same things, right? So good.
Hello, sir.
Yes.
Sir, it's Isha Pisar from Satara district, Maharashtra. I have a doubt that after completing the MBBS degree abroad, like I took admission in Georgia. So there was a myth or rumor like we need to complete PG unless and until that we can't return back to India or give next.
ये किसने बोला? I doubt.
Like that's a rumor, like it's so widely spread. Like we need to have independent license in Georgia, otherwise we can't give the next exam and can't.
I mean, if you want to practice in Georgia, then that's a completely different story, right? If you want,
no, I want to practice in India.
So boss, no one can stop you. No, no one can stop you. No one.
So
can
that's a myth, right? Like we can't come to India. That's a myth. Like after completing 6-year program, I can come and give next.
Surely.
Definitely. Because many other consultancies are saying that don't go to Georgia Otherwise, you will have to spend 9 years there.
नहीं. फिर भी I because you raised this question, तो I'll just confirm it. By the way, you are very smart.
Thank you.
क्या thank you? मैंने अच्छा नहीं बोला.
Yes, sir.
हाँ, सबका वो जो क्यू जंप करके सीधा बीच में से अनम्यूट कर दिया. That's why.
Okay.
Don't be sorry. Don't be sorry. Right?
Okay.
चलो.
Thank you.
रिचा फटाफट. चल रिचा.
Excuse me, sir. May I?
हाँ चलो बोलो तो रिचा wait a minute.
Sir, the doubt she asked, I had the same doubt actually, but the counselor was like, unless and until you have not qualified your NEET in India, just the qualification marks, then you cannot come back to India and give next.
Give me a date. I'll just.
But I choose to do MBBS, and everyone started saying that engineering will be completed soon. How much time it take you?
Do one thing. Send a mail to me regarding these things, right? So that properly I'll just confirm and will let you know.
This will take a lot of time.
Who is that? Sarika. What's your query? What were you asking? Hello.
Sir, can I introduce myself?
Who is it? Go ahead. चलो यार फटाफट.
Hello, sir.
Hello.
Good morning.
Morning.
Good morning, everyone. Myself, Vishwa Medical. I am from Mumbai, Maharashtra. I have completed my standard 10 from St. Joseph Convent ICSC School, Lodhivali, and I have completed my standard 12 from St. Andrews International School and Junior College at Akurli, Panvel. This year, I just gave my NEET exam and I'm planning for MBBS abroad. The reason behind becoming a doctor that my family has suffered a lot. My grandmother had around 5 to 7 abdominal surgeries. My mother had 2 surgeries. My father had 1 bypass and 1 big surgery. So it is becoming a doctor is in need of an arm.
All right. Okay, chalo. Now, I think.
Sir.
Who is it?
Richa myself.
Yes, Richa.
Sir, I have a different question about after MBBS abroad, like you have to give next. So what is the pathway to UPSC CMS exam?
What is the pathway to?
UPSC CMS exam, medical officer.
That is a very good thing. We'll talk about it because any of this public service examination, right? Public Service Commission examination.
Yes.
They are. It is in fact a very nice thing to think about it. So where you are serving India only, good one. We'll talk about it. Sure.
Because
yes.
I want to prepare for that. So I want to prepare for that exam. That's why.
Yeah, because say there is a common exam, then there are electives, and then there is interview. It is a 3-stage exam, right? So,
yes.
So in SPIPA, Sardar Patel Institute of Public Administration. So this is the organization, government organization. I take lectures over there, and my students are like IAS and IPS officers and custom officers. So yes, I'll be able to help you that how to prepare, right? No worries. Just send a mail to me. I can send you even some of the material
yes.
so you can plan.
No problem.
And so are these classes only for those who are pursuing MBBS abroad? Like, I think I might get a seat in India this year, but the further studies, I'm like fully sure I want to do it in the abroad only. So even I will be able to attend these lectures, right?
Yes. Achha, now anyone, now because there are so many hands, so straight away, you will be telling your any query, right? Okay,
Hello, sir.
You can just stop.
Hello, sir.
Yes, go ahead first.
So I have doubt that will I able to understand abroad teachers English accent because we here speak in Indian accent, no? In teachers also speak in Indian English accent, no? So can we able to speak in can we understand teachers English accent there?
Well, it is exactly like if you watch English movies, right? So for the practice, initially we start with those subtitles. But as you start watching more and more, gradually you can turn them off and you'll be able to understand it. And over here, the biggest advantage is that in medical, they will be talking about the medical terms. So those medical terms, they are like keywords. You pick up the keywords, बाकी तो कुछ भी बोले, right? सब पता चल जाता है. So you won't face that problem. But हाँ, English समझने में कई बार थोड़ी देर लगे. That's why I'll be telling you time to time कि watch the English news with the subtitles. Watch the English movie, watch the English serials with the subtitles. पर फिर ऐसा नहीं कि दिन के 5 मूवी देख रहे हैं कि सर ने बोला था कि प्रैक्टिस करनी है इसीलिए. Right? That should not happen. Yes, Mahima, Kunal,
Sir, can I speak?
Yes. फटाफट चलो. Query हो तो
Myself, Om Prajapati.
हाँ.
And I want to do specialty in neurology and I want to become a surgeon. And the strong reason for becoming a doctor is like I don't have any doctor in my family, and my grandpa have a dream to have a family doctor. And sir, one thing you forgot to wish me. You told that you will wish me.
I wrote that thing. वो मैंने लास्ट में रखा.
It's okay, sir. No.
मैंने लास्ट में रखा था, आपने डिस्क्लोज कर दिया. Anyway, today is Om's birthday, right? And it was written over here. Right? Om's
Thank you so much, sir.
Wish you a very happy birthday.
Thank you, sir.
Thank you, sir.
So can I speak?
हाँ चलो अब who is it?
Ishan.
Ishan. हाँ बोलो. Yes.
Yeah, good morning, sir. Good morning, everyone. Myself, Ishan Ganesh Pandya, and I'm really interested in specialization for cardiology, and I'm a bit nervous about it, but at the same time, I'm excited as well. And I have a doubt as well. Few people I have seen saying that once you have done the USMLE, like if you have clearly passed the USMLE, you can practice anywhere without the entrance exam.
Yes, tomorrow we'll be discussing again more in detail. Once you clear your USMLE, you are allowed to practice in almost 35 countries. Even after completion of USMLE, if someone comes back to India, they need not give any of the next or FMGE exam. If someone goes to UK, he need not give PLAB. USMLE is considered as the father of all the exams. So yes, it is valid across many of the countries, not only US. So you are right about it. Vaishnavi, straight away, any query? Because now we
Yes, sir.
हाँ चलो बोलो. I know your name is Vaishnavi Gaikwad. You are from Mumbai.
Yes.
मैंने random
So-
नहीं बोला. हाँ चलो.
I am very much passionate about healthcare, and that's the reason why I wanted to pursue medicine specially. So, I want to become a general practitioner in Australia. So, when you're gonna tell about USMG on the Saturday lecture, can you give more information on to AMC too?
AMC, sure. We'll talk about that
Thank
also.
you.
Definitely. Reva.
Hello, sir. Yeah. Hi. My name is Reva. I actually had a doubt regarding USMLE and FMG. Could you tell me which is a better pathway among them?
What's the doubt?
Which is a better pathway if we compare USMLE to FMG?
USMLE to
FMG. Next exam.
FMG. Okay.
Yeah.
You like sweets?
Yeah.
Yes. And you like namkeen?
Yeah.
Which one is better?
Both are good.
Both are good, na? Same thing here.
Yeah.
If you want to practice in US, USMLE is good. If you want to practice in India, then FMG. Both are good.
There are no major difference among them.
That difference is in the exam style. That's why you need to set up the target very specifically, that what you really want to do in life. Now, if you are very sure you want to stay in India only, so then give your heart and soul and crack the FMG exam, NEET PG tremendously, because you are straight away on the firing line with those Indian students.
I'm very much interested in Gynac, so like Gynac has a better future.
Every line is good. Every line is good. I'll say every line is good. You be the best, right? And you go into Amazon jungle या Sahara के desert में जाके बैठ जाओ, open your clinic over there, patients would come. Patients would come, right? कहीं पे भी काम.
Yes. Thank you.
Right. Okay.
Sir, I have one question.
फटाफट बोलो कौन who is it? Samarth.
Sir, as you said that Saturday you are going to explain about USMLE, would it be possible for you to provide some information about DHA medical test, because I am planning to practice in Dubai because of that?
अच्छा, ठीक है, will include it, no problem. In fact, I'm thinking of that. जो भी मतलब ये exams हैं for rest of the countries, will take that, no problem.
Okay. Thank you.
Yes, Sohani.
Hello, it's Swaranjali Shinde.
Smart Swaranjali. नहीं बीच में jump मारा. चलो बोलो फटाफट.
As one student asked you that after 6 years, it is hard to come in India to give a next exam. We requires the 9 years to complete it. Then can I get confirmation about it?
Confirmation about what?
That we will come after India after 6 years.
So after 6 years, once you are back, you have to appear for that exam, right? By that time, it will be next national exit test. So once you clear it, you are eligible for practicing in India. But if not, in case if there is any trouble, so then you have to attempt it again. But it is compulsory exam. After that only you will be actually getting the doctor behind your name.
But after PG we will come here, or after MBBS?
After MBBS. So it is like, this is the MBBS. You complete your MBBS, then you have to appear for next. Right now it is FMG, right? If it is FMG, then after clearance of FMG, you have to give NEET PG. And in NEET PG, according to your performance, you'll be getting the post-graduation admission in whatever the field you get it. When it will be next, so then straight away it would be PG. If the FMG is removed, so then NEET PG will also be getting removed. And this is the next exam, which will be compulsory for Indian students as well as abroad students. So everyone will be taking part into it, and that's where your rank will matter.
Sir, but we get junior license.
I mean, once anyone clears this next exam and after that he or she decides कि no, मुझे अभी PG नहीं करना या PG में नहीं मिला admission, no problem, they can still practice in India or they can apply next time. So definitely, person would be a doctor. Yes.
In Georgia, we get a junior license. Is that valid for next?
Your completion of MBBS is sufficient for appearance for next. Baki, you know, they say that they give you the degree of MD. No, याद रखना, ये MD is not equivalent to postgraduate degree. It is MBBS only. In some of the colleges, they give MD. No, वो MD नहीं है. It is not post-graduation. It's to be clear for that.
So there is no issue of license for a post-graduation?
This is the pathway which I showed you. That's the pathway.
Thank you.
So, earlier, someone had a doubt regarding USMLE. I just wanted to share a bit knowledge that I have, and you said you'd research about it as well. Can I ask?
See,
So
if the question is about USMLE, na, to tomorrow we'll be discussing it. Tomorrow we'll
No, actually, you said you would research about it, so even I had the doubt. Yeah, so basically, some of the consultant they said after USMLE, you complete the PG in USA, and then after that you can practice anywhere. So it's not just the exam that you do, but also the PG.
Obviously, na. See, USMLE is what? USMLE is United States Medical Licensing Examination. In simple words, you are doing MBBS, but USA is telling that no, we don't trust your MBBS. But because you have done MBBS anywhere in the world, you have to clear step 1, step 2 CK, and then occupational English test. You register yourself for ECFMG, and it is at that stage they'll say, yes, you are MBBS of USA. Now your value is that. But now you want to practice. So that practice, that is when you are affiliated with any of the hospital, any of the medical facility. During that, you have to go for step 3. Step 3, which is pure clinical, where you will be dealing with the patients, right? Once you clear that, and then whatever the specialty you are in, you'll be going for the residency and the specialty. And it is at this specialty, in Indian rupees, I'm telling, when your pay scale would cross 2 crore.
Sir,
Also, a lot of people were saying that after 6 years of MBBS in abroad, we have to do 1 year internship in India also after returning. So is that true or not?
Yes, that is true. In India, you will be requiring 1 year of internship. So that is the time which you'll be utilizing in case if you're not given the step 2 CK, right?
Okay.
Or tomorrow it will be at length. Oh my God, so many emails. Acha, chalo. Now what we do is all other. Yes, any specific query.
Sir,
but thing is, USMLE के लिए मत पूछना. Tomorrow we'll be discussing it. Anything else?
Sir, I want to ask. Sir, hello, sir. By the way, I'm Nirmit Das from Mumbai.
Nirmit.
Sir, I want to ask that in abroad the patient footfall is very less. So how we can practice there in abroad, and how we can there is the huge difference in India and abroad patients footfall. So how we can manage the real time experience, that how to communicate with a patient over there and here. So I want to ask this. So.
Okay. Tomorrow we'll be discussing this in slightly more detail. But to reply to your question for today is,
yes, sir.
There cannot be any comparison. In Indian hospitals, the crowd would be like heavy. In civil hospitals, means in every OPD, the total number of patients which are handled, it crosses 5 to 6,000. 5 to 6,000, right? That is no way one can get that sort of experience, because in radiology, we used to watch 200 X-rays a day. 200 X-rays a day. We used to do multiple, मतलब सुबह 9 बजे से लेके शाम को 6 बजे तक, मतलब we were working like machine. But that exposure, you cannot expect in other countries. Yes, you are right, because the inflow of patient is less. At the same time, it is segregated. Not every patient is allowed, means you are not allowed to handle every patient. Then tomorrow we'll be discussing what is inpatient and what is outpatient, and what is the value of it. But yes, that difference would always be there.
Yes, sir. That it will affect the clinical based test exam and that practical.
No doubt about it. It would. And that's the reason that you have to be very strong. There are methods by which we can really improve ourselves, or we can take ourselves to that level so that you can handle the patient. But yes,
sir.
क्योंकि वहां पे से, for example, if you have auscultated 1,000 patients, so the moment you put the stethoscope, you'll say this is mitral stenosis. You'll say this is regurgitation. This is pansystolic murmur. Seconds mein you'll say. But otherwise, you have to really think of. You have to rely on some other sources. So, for example, in my recorded sessions, you have to rely on that this is how I'll hear on the cardiac auscultation. जब stethoscope रखो तो क्या सुनाई देता है. Now, some things They are like your brain should really get that feel. Ki, हाँ, this is what it is. So, yes.
Sir, can I?
हाँ, बोलो बोलो.
Sir, which country is better for pursuing MBBS, Russia or Georgia?
Georgia means Russia is extreme cold. When I went over there, मतलब it's extremely cold. And language barrier तो दोनों जगह है. But I would say मतलब अगर जो आपको chance मिल रहा है, तो I would prefer Georgia.
Sir, except this climate condition, there are any other?
मतलब देखो, everywhere one thing is very clear, the concept of self-study. I'm telling you at this stage, मतलब don't expect कि जैसे एक एक हाथ पकड़ पकड़ के एक एक चीज पढ़ाई जाएगी, वो मत expect करना. That won't be possible. यहाँ पे over here we are discussing this, we are talking about this, and we'll be teaching you all the thorough basics, literally जैसे हाथ पकड़ पकड़ के एक एक चीज. But over there, yes, you will find that they go at a very high pace. Course खत्म करना है. The way it happens in many of the colleges in India also. It happens. होता है. Right? So,
Sir, does FMG pass ratio matters?
FMG?
FMG passing ratio matters.
Sure matters.
When it comes to choose the college.
It matters. It matters. मतलब when because ranking is given. उसके बाद when you will give, अभी तो देखो FMG आप लोगों के लिए तो आप भूल ही जाओ. It will be the next exam, right? So don't worry about FMG right now. वो निकल जाने वाली है. That exam would be abolished because we are talking about 6 years from now. तब तक तो next आ ही जाएगी.
Sir, can I ask my query?
Sir, can I ask?
Okay. Now let's do one thing. If any of the queries regarding future exams, right? So send a mail and I'll incorporate those queries tomorrow, right? If it is anything about USMLE or FMG or next, I think we have discussed sufficiently about the exam part. So in case even if there is anything else, just let me know.
Sir, can I ask?
Yes, go ahead.
Sir, I wanted to talk about the thing that you said to one of us about what we'll do in India in vacation when we come here. So you talked about the blood donation camp and helping in it. So can you list out some things that we can do while we are in
tomorrow we'll do that because that is part of how to enhance your CV, right? Again, related to USMLE. Because in USMLE, one of the things is how to enhance your CV so that your value increases. So during that session, we'll be talking about more in detail.
Sure. Okay, sir. Thank you.
All right.
So
Yes.
I'm next in queue.
Hello. Okay. Go ahead.
So I'm Sanika. I'm next in queue. Can I ask a question?
Go ahead.
So actually, I've been on the receiving end of medical care for almost a few years, like 3 to 4 years. Chronically, I had to undergo 4 to 5 surgeries. And the one thing that I realized that the super specialist which I was visiting had extreme patient experience. Like they were from PGI Chandigarh or extremely high level competitive government colleges. And what I used to see is how the experience was. Like, a person who is from PGI has a vast range of experiences, and I didn't have to explain to them about my condition. They used to just understand it. And I feel that when I do a foreign medical degree, I will lack that experience. So I search for AM observership, which can be done after first year MBBS completion. So can you guide us on what more clinical exposure we can get?
Tanika, you cook?
Yes, sir.
So you are a good cook?
Yes, I like my cooking.
Right? But so this is exactly like that. This is exactly like that. You might not have served more than 10,000 people, but still you are good in cooking. right? So that is your understanding in that particular subject. Same thing happens. See, many of the things they come by intuition. As you will see more patients, as you will study any of the disease properly, the moment patient would start speaking, automatically you'll start eliminating. It would be like not like artificial intelligence, it will be like a real intelligence, right? You'll start deciphering. So there is something what is called as the history taking. History. So when the patient is telling his own details, so that's why I say it is his story. So when the day you start listening to his story properly, you'll automatically start deciphering what is called as the process of elimination. So you'll eliminate, no, this is not the disease, this is not the disease. And finally, you'll come across what is called as the DD, differential diagnosis. And that is when you suggest few of the tests, and then you come to the conclusion that this particular patient is having what problem. All these things, they are intuitive. It is not so that from one particular institute, only a person can be, say, that effective in the diagnosis. You yourself will be that effective once your foundation is good, right? So not to worry about. And surely it is like as you practice, as you become more and more senior into the subject, say, I do cook, but my cooking might not be as good as yours, right? Because
actually, I'm a little scared because being on the receiving end, I know how critical few conditions are.
You are not scared, you are anxious, right? It is
Yes, of not being good enough.
So no, don't worry, not to worry. Yes, Rashi, Janvi, Mahima, Atharva, Sharvari, Manthan, Ishan, Karan, I'm getting your emails. I'll just see them later.
Sir, excuse me, sir.
Sir, I have another query. Can I?
Later. Let's finish fast. Yash, any query?
Yes, sir. Myself, Yash from Nasik.
Chalo, bolo.
And sir, my dream was to complete my MBBS course from AIMS, but I didn't get that much rank so that I could took admission in AIMS. So can I do my post graduation in AIMS after coming from abroad?
AIMS conducts its own exam, right? AIMS conducts its own exam, and they are deadly. Trust me, they are deadly. If you crack them, yes, why not? You'll be able to do your post graduation from AIMS, All Institute of Medical Sciences. You can, but the exams are deadly. Take my word for it. And the competition is very severe. Out of 10,000, 3 seats, right? So just remember, it is in decimals. Those who are successful.
So are they more tougher than NEET PG and next exam?
Definitely more than NEET PG. Definitely. And the interviews, they literally drill you. They are deadly interviews because they know that it is one of the finest institutes, so they want best of the best. So obviously their interviews will be equally tough.
But, so is it difficult than USMLE?
We won't be able to. Again, it is like sweets and namkeen. Right? It is like sweets and namkeen.
Okay.
Over here, this is Indian setup, so things will be a bit different.
Hello.
But yes, if you are good into your subject, so then you can.
So actually, I asked you about the observation, which is
observationship and electives. That is the part of. That's what I said that tomorrow we'll be discussing the difference between electives and the observation.
Would be discussing about next exam and all the fee structure tomorrow.
No, we'll not be touching much on the. In next, so there is not much of the fees. In USMLE, there is fees involved. Every exam will be costing $1,000, $1,350. In case if you are changing it, rescheduling it, it will cost you extra $500, etc.
So you will be providing classes for next also, right?
See, Abhi, at this point, training for none of the exams. My concept is your foundation. Once this is good, as we'll study, the subjects, so they are going to remain same, right? So then at a later stage, when we'll see, if whether it is USMLE, because this step 1, in any case, it comes after 3 years. After you complete your anatomy, physiology, pharmacology, pathology, forensics medicine, biochemistry, microbiology, right? And then medical ethics. after that you will be able to appear for step 1. So एग्जाम के लिए अभी से सोचना not needed, not needed. Make yourself, your subject powerful. ठीक है ना?
Sir,
हाँ.
sir, what if we want to complete our MD? If I choose Georgia, sir, if I want to complete my MD and then if I want to return to India, there will be the different kind of exams for it.
I think yeah, there has to be. वो देखना पड़ेगा. I'm not very sure about those exams, but yes, it is possible. But once again, when you come back to India, तो you have to appear for. India में practice करने के लिए next तो चाहिए. That is compulsory.
Yes, sir. That next is after MBBS, right?
MBBS, after MBBS.
What if we want to, like, if you want to practice in Georgia, if we take a MBBS from Georgia, and if you want to practice
हाँ,
there,
तो then if you want to practice in Georgia, then no need to appear for exams in India. नहीं.
Yes, sir. And what if we want to complete our MD at Georgia, and then what if we want to practice in India?
No, that thing won't be valid. That thing won't be valid.
Yes,
Georgian degrees, Georgian post-graduation degrees are not valid in India.
Okay, yes, sir. Yes, sir.
So
And
you'll
we
be
have to
considered,
write other
you'll be
exams.
considered as MBBS only.
Oh, if we do the post graduations also, we are considered as MBBS here itself.
The way simply you do your MBBS, MD, even MD from anywhere in the world. You want to practice in US, you have to go to step 1, step 2, step. वो जाना ही पड़ता है. They don't consider. It is the rule of say NMC, National Medical Council, or in US it is ECFMG, or in UK it is General Medical Council, GMC. So all those Australian Medical Council, it is the rule of the country. So
yes,
no one
Sir, I
can.
also want to ask the same.
Yeah.
Yes.
But we crack the USMLE, then we can come in India.
See, what I am telling is regarding the exam part, USMLE, PLAB, वगैरह, we'll be discussing tomorrow. Any other query or doubt?
Yes,
May
sir.
I? Sir, can I?
Yes, go ahead. Is it Urula or who is it?
Yes, sir. It's me.
Go ahead.
Sir, I wanted to ask regarding the study material. Like, when are we going to receive it?
When you are going to receive it?
Yeah.
I mean,
the counselor said that we'll be getting e-books.
So then yes, so if they have said, you will definitely be getting those e-books.
And regarding these classes that you'll be conducting, the study material is going to be the same. So will you be providing us beforehand, or will it be like when the classes start officially?
Simple. It will be very simple. Say regarding any of the administrative part, say I won't be able to answer. Right? I'll be handling only this education part. Regarding whatever the topic which we'll be discussing, at the end of it, the PDF, right? I'll be giving you the link of my Google Drive. So in that Google Drive, the moment, it will be the same link which you have to follow every day. So it is once we complete our discussion, that PDF would be landing into that Google Drive and you can always download from it.
Okay, sir. Thank you.
And at this point of time, I'll not insist that straight away you start reading those heavy books. No need to take it that.
Sir, I actually find it interesting to read, and hence I was asking for it.
Surely, if you find a book interesting, go ahead. But if you want to take it light, to whatever the topics which we discuss, just try to digest them thoroughly so that there is no doubt.
Okay, sir.
All right. Yes, Kanishk.
To make notes.
Yes, sir. Hello.
Hello. Go ahead.
Yes, sir. My name is Kanish Karwekar. I'm from Kolhapur, Maharashtra. And so for now, my aim is to just to complete my MBBS. And I'm not sure about my PG, sir. Means I've not decided yet what to do in my PG. So I'll be deciding throughout my graduating years.
It happens exactly like that. आपको बताऊं? मतलब as a male, मतलब whosoever we seek we feel like कि ये मेरी girlfriend होनी चाहिए. Same thing happens when we are into various. जब ऑफ्थेल्मोलॉजी पढ़ते हैं वी फील करना ही बॉस ऑफ्थेल्मोलॉजिस्ट बनना है. व्हेन इट इज कार्डियोलॉजी का रोटेशन होता है वी फील करना ही बॉस कार्डियोलॉजिस्ट बनना है. So that love keeps on changing, right? But it is by the end of the MBBS we really come to know that who is our genuine passion. So it's completely very honest. You are very honest. Yes.
Yes, sir. Yes, sir.
So
Thank you.
life would teach. Pratmesh. Yes, Pratmesh, go ahead.
Sir, can I ask a question?
Pratmesh, na?
Sir, no, this is Preetam.
Preetam. Bolo.
Sir, so if I do my PG in US, so if I have to if I have to practice in India, do I have to give any exam or how is it?
दोस्त रामायण पढ़ी थी?
Yes, sir.
सीता को कौन उठा के ले गया? अरे यार तू at this stage you are asking this question, the thing which has been discussed not less than 20 times. कितनी बार बोला? अभी हमने बोला कि after MBBS if you want to practice in India, you have to appear for next. जब आएगी तब, अभी के लिए it is FMG, right? Foreign Medical Graduate Examination. दो ये these are compulsory. Then you can practice in India. उसके बाद post graduation करना हो तो करो, नहीं करना तो GP. Want to go to US? They don't consider any of these exams. They say go give US MLA. तो उसके बाद then practice in US, right? So he was Ravan जिसने सीता को उठाया.
Hello, sir. Hello, sir.
Wait. Kanishk, फटाफट. Kanishk, बात हुई अपनी, right? I think you talked.
Yes, sir. Yes, I have. We spoke.
तो just and Sakshi. Any doubt? Any query? कुछ पूछना है? फटाफट. अरे
I had a query.
Yes. Next, Sakshi. अच्छा, Sanjana. Okay.
Excuse me, sir. So you said that it depends on self-study. So how does that FMG ratio matters?
Simple है ना यार. No one will teach you each and every topic whatsoever is asked. So in all these, in MBBS, self-study will matter a lot. मतलब वो कई बार टीचर्स जो है वो कोई टॉपिक बहुत शॉर्ट में खत्म करेंगे, बट द टॉपिक्स आर इम्पोर्टेंट. ये क्लास क्यों रखे हैं हमने? जस्ट टू ब्रिज डाउन दैट गैप. मतलब सो दैट कि जो इंडियन मेडिकल स्टूडेंट्स यहाँ की कॉलेज में जो पढ़ रहे हैं, you get the same experience. Otherwise, surely I'm telling you that you'll find
it depends on college and self-study both.
हाँ, बिल्कुल. सेल्फ स्टडी तो करना ही पड़ेगा. सिमरन. Okay. Prajwalita.
Hello, sir.
Prajwalita, you are in queue. Nothing. Okay. Afsha.
Hello, sir.
Prajwalita. Okay, go ahead. Yes, fatafat.
I'm Prajwalita Pukule from Mumbai. My query is that after passing the next exam, I want to take admission in PG. Then there will be 20% seat overall to the total amount of students sitting there. So is there any chance is there anything like that FMGs don't get that priority as compared to Indian medical graduates? If I am competing with a Indian medical graduate, then there is a very less chance that I will get that seat.
No, nothing like that. Whether you are done from India or you are done from Georgia, right? You appear for this FMG, and then comes the NEET PG. This NEET PG, Indian students, they will be coming directly. Over there, they don't care from where have you passed. What is your score over here? That will decide your future, your post-graduation admission. Simple. So yes, that's what I am telling, that you will be under direct firing line with the students, those who have done MBBS from India. Right? It will matter. It will definitely matter. Just a minute. So this is what we have discussed so many times. So no one can give guarantee that it totally depends upon your efforts, how much you are.
Okay. Thank you.
Now, these are the same questions which are getting repeated. Anything new, then please unmute yourself and
Yes,
ask.
sir. Yes,
Otherwise,
sir.
yes.
Hello.
Yes, yes, yes.
Sir, actually, I'm at this position right now कि either I have to choose to go in Uttar Pradesh in private medical college or in abroad for MBBS. So what should I do? What do you think is a better option?
Well,
उत्तर प्रदेश में करना चाहिए कि abroad?
Uttar Pradesh is a very gross term. Now, there are, say, two things will come. One is the finance. Definitely, you'll be paying much, much more over there into the private college. It goes into crores,
Yeah.
right?
Yeah.
And over here, abroad, it would be 1/4 the cost. So it is, this question is like depending upon the financial status.
Yeah, but like my parents are okay, but they are saying that I should prefer to study in India. So
That's what I'm.
like
Just a minute. Just hang on for a minute. Yes.
yes, sir.
So it depends upon the finance. And regarding the education, yes, there would be some difference. There would be some difference. You'll be getting more exposure for the patients over there in Rajasthan. But it is a matter of the amount which you are spending. That is pretty high.
Yeah, but the
If
regarding
it
the
is,
finance amount, my parents are okay.
so then you can take a call of the Indian college. If it is finance is okay, so then you can. Because very simple सी चीज है. If the finance part is not a problem, then people usually go for Indian colleges.
Yeah.
No? Simple.
Yeah, so exposure and also the faculty will be that of that standard, no?
Regarding the faculty, I won't be able to guarantee you. I know many of the Indian colleges also should not use the word, but the quality of training is not at par. No, it is like मतलब students रोते हैं. So before jumping into any of the college, do inquire properly. But because you don't have the problem of finance, so that's why you can opt for Indian college, but do check it properly.
Also, should I physically go there and inquire?
मतलब you have to deploy your sources. You have to deploy your sources.
Yeah, but like at this moment, we can't trust anyone. No? Like YouTube, also we can't trust.
Correct. No, because it would be very wrong on my part if I comment on any of the college, because I can't visit all the colleges, right?
Yeah.
So it won't be right for me to comment on any of the college. But what I'm telling you is in general. Say the colleges in which I'm studied or where I have given the lectures, I can say with confidence. They are the amazing colleges. You talk about AIMS, yes, I've been there. You talk about BJMC, yes, no doubt about it. But you talk about any other colleges, so I can't comment it. You know? It would be wrong and unfair if I do that. Yes. Any other query? Anyone else?
Hello.
Voice is chopping. I'm unable to understand. Yes, Afsha, anything?
Hi, good morning. I'm Aksha from Pune, Maharashtra. I'm very curiously passionate about like neurosurgery and how like neural networks and human anatomy align together, and like how it will enhance the neural patient outcome in future. My query was like regarding if we won't be able to like attend a session due to any obstacles. So, is there a way to get the recording and like how do we cope up with it? Like,
Send a mail. Send a mail. I'll reply to you in detail.
okay, okay, yeah, sure.
Yes, Diksha.
Hello, sir.
Hello.
Myself Diksha Bhagat. Sir, since Georgia follows European guidelines, so many universities does not allow students to practice on cadavers, except the Bow University. So, what are your opinions? Which college is better for the students who want to come back to India after MBBS to practice here in India?
No, say regarding the cadavers part, dissection you are telling, right? Dissection.
Yes, sir. Yes, sir.
Dissection, facility of dissection is only in India, where you are actually given the cadavers and dissect and watch every muscle, every nerve, artery, vein, everything. Due to this reason only, on my YouTube channel, I got the YouTube channel under my name only, Dr. Bankim Jani, right? The entire anatomy, all the regions, every region of the body has been dissected step by step, and the thorough discussion. Though we'll be taking that discussion also, we'll be doing anatomy again also, but it is already present over there. The real dissections. But you will always find that in many of the countries, yes, that thing won't be possible. They won't allow you for any of the dissection. So yes, you have to rely on either digital media, digital content, or you have to rely on the textbooks.
But sir, as per my knowledge, the Bow University, which is in Batumi, they allow students to practice on cadaver. So,
So
is
that's-
this the right information?
No idea. That's what I said. Say I won't be able to say comment on every college. If you have got that information, so whosoever is giving that information, you need to confirm from that, right? Because I won't be able to vouch for every university and every college. So
But sir, any suggestions about the Georgian universities? Anything, any college which is much better?
No. That's what I'm telling. I cannot comment on. I have not visited all the colleges. Even when I was in Georgia, I've been over there 4 times. But my lectures were like independent lectures. Students from every university used to come. Okay? So unless I am into that setup and if I evaluate, then it is okay. But otherwise, I cannot comment.
Okay, thank you, sir.
Add on a point here.
Yes, Vaishnavi.
Sir, I had a query. The same person like who asked about the UP college also. So I am also getting a college into Nashik, but I want to look forward, as I said, for AMC. So which is better, like doing MBBS from Georgia and then getting for AMC, or from India and then coming for AMC?
If you are getting admission in India, and right, and if you can afford that fees, then you can try that. You should go for it. But over here it is like 25 lakh rupees over here. So in India, it is like for private colleges, they charge about 25 lakh rupees a year. So
No, like the college which I'm getting in Nashik and also for the Georgia, the budget is going same.
So then
So
you
the
can just check out with the college part. There are no hidden fees, one. And second, is the education and everything is okay or not. So these are like you have to really check. Yes, Sanika?
And I also had one more doubt. That you are gonna teach according to USMLE or PLAB curriculum. So is it like enough sufficient for giving AMC too?
How many times I replied to that? I have to ask a reverse question. How many times I have replied to that? At this point of time, whether it is USMLE, PLAB, AMC, any of the thing, the content, medical content, it remains the same. You have to think about any of those exams at a later stage. That is after 3 years, right? tomorrow we'll be discussing USMLE just to give you the brief idea about that this is what is going to happen in future. This is going to happen in future. So that's why prepare right from the beginning. That's it. That's it. So there is not much of the difference. There is no difference. Not much. There is no difference between content of USMLE, PLAB or AMC or any other exam in the world. It remains same. Right? The asking of questions, question pattern. But otherwise, they won't stick it. For USA, there is 3,000 gram of brain, and for India, it is 1,600 grams of brain. Or US guys, they are studying 4 kidneys, and Indians 2. No, it remains same for everyone. Na? Why that? Sanika?
Yes, sir. Actually, I had a question that I negotiated with a local doctor, and the sir has allowed me to shadow him with
Super.
help. So should I join it, or am I rushing?
1,000%. 1,000%. Not 100%. 1,000%. Because if shadowing is allowed, awesome. Go ahead. Beyond doubt. It will add so much to your clinical knowledge. Jarur karo. Shabash. Arnav.
Yes, sir. I just had a simple query. After completing our MBBS from Georgia, are there any particular issues we will face in India?
What type of issues?
Sir, like clinical or related to exams or something?
I'm not very clear what exactly you want to ask.
Sir, like clinical issues while practicing or like the exam next and stuff.
I mean, if you're studying, if you know your subject well, right? Simple. If you know your subject well, no issues. Simple. No issues. You should know your subject well. Then whether you are practicing in India or US or UK, no problem. You should know your subject well. Many times it happens. After doing this, you are going to US for a lecture, right? You give a lecture over there. You go to Dubai, you give a lecture over there. So MRI spine will remain same in any of the country. No issues, no trouble. It remains same. Know your subject well, irrespective of from wherever you are studying.
Okay, sir. Thank you.
Welcome. Prathmesh. Prathmesh is...
Sir?
Who is it?
Excuse me, sir.
Naina? Yes, go ahead.
Sir, if we get any clinical exposure here for us, like any our parents or guardians are working at hospital, we can just go with them and check out what all is there and all.
Yes, that is called
Will
as
that help us?
that is called as shadowing.
Yes, sir.
So Hansika, you have asked the question, so I think I have answered your question. Right? Those who are doing the practice and you follow them, right? साथ साथ घूमो, देखो क्या करते हैं. That is shadowing. Yes, Pratmesh.
Sir, can I ask something?
Who is it?
Siley.
Siley, go ahead.
Sir, first of all, thank you so much for giving such an awesome guidance from zero level to extreme.
Yes, go ahead.
I'm extremely thankful as I come from a background where there is no doctor in my family. This session was very helpful, and I'm sure I have found a really nice guidance for my future also. And my question is that I am planning to study in Georgia, and there are two universities I am confused in. One offers the cadwers and things, and second is there is it's in Tbilisi, so there is more clinical exposure, more people are coming over there, and it has its own hospital. So what should I choose between a university which has its own hospital or the university which approves for cadres.
Clinically speaking, any of the medical college, right? It is necessary that they will be affiliated with one or other hospital. Without medical affiliation with any of the hospital, that college cannot survive. It is impossible. One cannot create one medical college absolutely isolated with no patients. Possible ही नहीं हो सकता. Clinical rotations are compulsory. So it is not so that there is one college which has got no hospital attachments. No, there will be definitely some hospital attachments. Just figure it out. You will come to know.
And sir, about comparison between clinical exposure and cadavers, which
No,
is better?
the cadaver is for cadavers in India, in BJ Medical College, say a body was given to one batch. One batch means a small group of 6 students. So those 6 students were having access to the entire body. So in our dissection hall, there were more than 60 dead bodies because the batch was of 240 students. Sometimes when they say, yes, you'll be allowed to see on cadaver, but will they be allowing you to dissect? And if the cadaver is given to, then that is between, say, 40 students, then who will be doing the dissection? So many factors. So the proper answer will be just confirm properly. Just get the details properly. Having only the advertisement part that, okay, you will be given the cadaver, but will you be allowed to dissect? That is more important. Between how many students a dead body would be given? And now if it is given between 40 students, तो then last वाला तो यूं करके ही देख रहा है, मुश्किल से कुछ दिखेगा.
Okay, sir.
Very important. Yes, Tanvi.
Sir, I wanted to ask about NMC guideline about 10-year MB course should be completed within 10 years.
So that you have to Google, yeah. Because all those things regarding the guidelines, etc. So it is like that lawyer writing all the things. So you have to just Google it because that way you'll be getting the latest thing.
Sir. Okay, sir.
Yes, Tanvi.
Sir, if the cadavers is sharing among 20 people, then it will be a good.
No. Or you have to be very bold and powerful to take the initiative and sabko ke chalo hato, I'll be doing the dissection. So it becomes like a jungle raj. Whosoever dominates, he is doing the dissection, he or she. Arish Raj.
Hi, sir. Sir, on what basis can we decide a college in Georgia except the financial condition?
Say your consultants, they will be giving you that. See, regarding the education part, more or less it will remain same. Plus or minus, it will remain same. Right? So there won't be much of the difference. हाँ, कोई contact हो, कोई senior का contact हो या कहीं हो, तो then you can ask about that college in more detail. Or there are several sites. Quota पे जाके you can just check it out.
Okay, sir. Thank you.
Hello, sir.
Yes, Ritik.
Yeah, sir, I had a small doubt which I myself am confused to select from. So, since this was my first time giving NEET, and I had decided that I didn't want to take a drop and just go to abroad and try to pursue MD program there. But now that I have consulted a lot of people, half of them are telling me to give yourself a try and appear for the NEET exam again. And some are telling that you should not do it and everything. So what are your thoughts on this?
Say, what was your score?
So it was very low, but I did qualify for it.
Okay. I would say if you are very confident and if you want to give your heart and soul and you feel like, yes, I'll be able to score so properly in the next shot, so then give it a shot. It totally depends upon your confidence. It depends upon your confidence because it is a big step. In case if it backfires, in case if the score is less, so then everyone will be shouting on you that you have wasted important duration of your life.
Yes.
It is like a double-edged sword.
Yes, sir, I did talk about that, but then they are telling you should try to give yourself one try at least because now that you had to
Don't
give
listen
your
to anyone.
11th and 12th.
Don't listen to anyone. This is the point where you listen to your heart and brain.
Okay, sir.
If your brain tells कि हाँ boss, no problem, हो जाएगा. And if your heart tells कि yes, I can do it, do it.
Okay, sir. Thank you.
From Pratham.
Yes, sir, I have a confusion in my mind that if I complete my MBBS in Georgia, so after returning to India, will the medicine difference will be there or not? Means names of medicine.
Don't have to worry about it. Because in pharmacology, what you will be learning is not the name of the medicine, but the contents.
Okay.
Right? So it is the brand name it changes. It is just the change of the brand name. So otherwise, no problem, no worries.
Okay, sir.
Right? No worries, not at all. Yes, don't know your name, but it is just V2310.
Yes, sir. I'm Kranti Deshmukh from Amravati, Maharashtra. And I'm decided to complete my MBBS from Kyrgyz. So, what's your opinion about that?
I want to do it from
Kyrgyzstan, from Central Asian University.
See, that's what I said. I can't comment on any of the university if I've not visited it.
So, what about country?
Country is also, it varies from, say, university to university. In some of the countries, some universities are good, some are not. Say in India, not all the medical colleges, they are up to par. Many of the medical colleges, their standard is really pretty low. And students, they are struggling a lot. So,
okay, sir. Actually, sir, I have with seniors, they are studying there in third or fourth year. So, they think good for Indian student to complete the MBBS there.
So that is like a genuine reply. Because those who are studying over there, they will be able to answer it more effectively and honestly.
Yes, I talked with them and they said it is good.
Yes, if they are telling to, then no worries.
Yes.
Sure. Yes, Shriji.
Sir, some people think that कि अगर आपका नीट में स्कोर कम है, if you are scoring less in NEET, then you are not able to complete your MBBS. It's really, it means it's a high jump for me.
देखो, this is past and this is your new birth, right? This tells everything. Because intelligence और मेहनत किसी के बाप की जागीर नहीं है. पास्ट में नहीं हुई मेहनत, प्रॉब्लम हुआ, unable to score, that's okay.
Yes, sir.
But what about the future? No worries. Bilkul, strike back.
Yes, sir.
Right? So that's why tomorrow's session would be interesting for this reason. I mean, day after tomorrow, Saturday. All right. Yes, Shriji.
Sir, apart from all of this FMG and abroad questions, you were telling us about some super revision techniques at the start of this lecture.
Yes, we'll be starting it from Monday or Tuesday. That's super reading, right? We'll be starting it from.
Okay, sir. Thank you.
That is in plan. So no worries. Ayan.
Hello, sir. Good afternoon.
Good afternoon.
Myself, Sheikh Ayan. Sir, I want to ask, sir, if we have given USMLE exam of America and we have passed it, so we after studying there, we came to India, so we didn't have to give any exam, no?
You don't have to. USMLE is valid in India.
So what makes USMLE so superpower that if we clear that exam, so we have to give not exam in any country, not in India. What makes it so powerful?
Because the exam is like that. But because it is question about USMLE, we'll discuss it tomorrow. Okay?
Okay.
Sure.
Thank you,
All
sir.
right. Welcome. Yes, Urula.
Sir, I wanted to ask, does our NEET marks matter for the college abroad?
No, unless and until there is a tie. In the final interview, if there is another candidate who has got exactly the same score as yours, step 2 CK, step 1 is just pass or fail. Step 2 CK is that score. It is exactly same. The CV of both are carrying the same weightage. You have also done elective, that person has also done elective. Almost everything is same. So then they might go at a granular level to check about that what was your NEET score. Only in that case. But it is rarest of rarest thing. Normally.
And sir, I had read somewhere about that your NEET result for abroad is valid for 5 years, whereas in India it's only valid for the 1 year. So this was my like third attempt, and so after like registering for Georgia College, do I have to give the current NEET score, or am I eligible to give my previous? Because last year I had scored 615, sir, but sadly could not get college.
Okay. I think for this we need to check. Otherwise, the latest NEET score is considered.
Okay, so I'll have to give my current one.
Yes.
Okay, sir.
All right. So all said. Okay. Samja.
Yes, sir. So I plan on studying in Georgia. So I just wanted to know how, after 6 years, if I don't plan on coming in India, I just wanted to know how it will affect my practical experience as compared to India. Because here the amount of patients are quite.
Surely it will affect. Surely.
That's what
the
I
number
want
of patients which you'll be watching over there and over here.
Yeah.
It will make a big difference. That's the reason we said that when you come back to India, right, during your vacation, so at that point, try to shadow any of the doctor or try to visit any of the hospitals. So to compensate for that experience.
Okay.
Surely it will matter.
Yeah.
If
I do
Excuse me, sir. Sir, sorry to interrupt, but I would just like to, can I just talk to, she was asking about the last 3 years, right? So, sir, currently the last 3 years NEET score is valid. I was also going through the same process.
Okay.
So the counselor did inform me that I can go forward with the last 3 years, any of the last 3 year NEET scores.
Achha, any of
Wanted
the
to clear
score.
that for
Okay.
her. Yes,
Okay.
sir. Whatever.
Okay. Now this is good. Thank you.
Yes, sir. Thank you, sir.
This is like an administrative thing, but so it happens like sometimes but this is very good. Good thing on your part. Thank you.
Sir,
Bolo.
Is there any super specialization exam in USA after USMLE? After completing
there are so
postgraduate?
many. They are in hundreds. They are not any. They are in hundreds, been thousands. In radiology, there are 400 such things.
Okay, means it is compulsory to give exam. We can't
Not
get
compulsory.
directly admission.
It is like once you become consultant, you want to go for super specialty. It is absolutely up to you.
No, sir, not like
You
that.
are
I'm asking,
radiologist, and then you want to go for super specialty in MRI, and then also super specialty in MRI spine. So that is totally up to you.
No, sir, I was asking that for taking admission in super specialty, is it compulsory to give exam or directly we get admission after USMLE?
Directly, because once you complete your entire step 3, and then you complete your residency, you are now a postgraduate. You are a postgraduate, and once you are postgraduate, that means you are a full-fledged senior consultant doctor. So then you don't have to appear for any of the exam, but many of these programs, they cost you. They are not free. They cost you. It is like as a radiologist, let's say I want to go for some program which is about very advanced high resolution ultrasonography of hepatobiliary system. So then they will say, okay, this would cost 1 lakh, 2 lakh for 3 days. So in those 3 days, they won't be talking about any of the basics. Straight away, they'll be discussing some of the complicated cases and how to deal with it. Right? Because things will go at that level.
Okay.
And when you become senior, and if you are conducting such lectures, so then you are paid in the range of $3,000 to $5,000 for that lecture. Even more than that. You just one lecture, they'll go entire to and fro, stay, everything. On top of it, you get $5,000.
Okay.
Yes, finally, again, name is not there. So Samsung SME2.
Hello, sir. My name is Kapil Ingle,
Yes, Kapil.
and I want to ask that after the USMLE exam, I have heard that MS is difficult to become a MS doctor.
Regarding this, we'll talk tomorrow, right?
Okay.
After USMLE and everything, we'll talk tomorrow. All right. So I think we stop at this point, and day after tomorrow, we'll be meeting exactly at the same time, 10 o'clock, right? And we'll discuss more. We'll
Sir,
start
the
with we'll start
files.
we'll start with USMLE, and then we'll discuss something about what we should really do so that we improve our value and what are the practices which are to be followed. Okay? Take care.
This is
And
one. So you were saying something about that we have to do 3 minutes every day.
yes, that's what I said. All those practices which we'll be discussing day after tomorrow. That is on Saturday.
Sir, I have sent you one email.
Yes, all I got, there are more than 85 emails which have been unanswered. Oh, 189 emails which have been unanswered. So I'll answer to all these either by today, day end, or maximum by tomorrow. Okay?
Okay, sir.
All
Thank you,
right.
sir.
Thank you so much. Take care. See you soon.
Thank you.
Thank you, sir. Bye.
Thank you, sir.
Bye bye.
Thank you.
Bye,
Thank you,
sir.
sir.
Thank you, sir. Bye,
Thank you,
sir.
sir.
Bye. Bye.
Thank you, sir.
Thank you.
Thank you, sir. Bye.